page are we talking about?
2819A. I can hand it to the court if it's easier. 2819A 003. The defense's issue with this, Your Honor, is that there's highlighting that's embedded in here. The reason being, I received the paper on Friday evening, and as I was thinking through questions, I highlighted some things. We're not able to cure that at the moment, so either they go back to the jury like that, or perhaps the defense can send us these pages for Ms. Green this evening, and we can send back to the jury without the highlighting. Oh, you told us it's okay?
Yeah.
Oh, it's okay. Never mind.
All right. So the highlighter gate is over before it even began. And so Ms. Quarles is reviewing the last exhibit.
Yes, Your Honor.
Now, and I don't know, Mr. Shapiro, if you're able to, Ms. Quarles earlier today said that there was one defense exhibit she wanted. Are you able to pinch hit for her?
Yeah,
Since we've got 6 minutes.
not accurately, it would be wherever, if you don't mind.
Well, I want her to finish whatever she's doing, so.
Okay. I can ask permission. Your Honor, while we're in a lull, when we're done with this, the jury's going to come back and there's going to be the rebuttal case, right? So I guess I'm trying to figure out, I won't be needed till late in the day? Later in the day.
I mean, I'm going to be giving the jury instructions. I see you sent around two cross references that have to be changed. Hopefully,
In the verdict form, yes.
you know, I don't know if you are coming back later on this afternoon or not. I don't know. That's up to you and your team.
I can come whenever I'm needed. I was just going to, what I was going to do, I don't think I need to be present for the rebuttal case. I was going to go ahead and sign off now, and then maybe Samantha or somebody can let me know when it's, or Nick, when it's time to come back.
I think they heard you.
Right. I'll text you.
Okay, thanks, Nick. All right, we'll see everybody later. Thank you.
Mr. Shapiro.
Sure, there was 2 exhibits that were discussed with Ms. Beatty during her direct and cross-examination. Clay, can you pull up 3217-0722? This is with regard to the birthday card that there's some dispute over whether it was delivered. You know what? That's fine. It's part of the group from 718 through 722. If you want to start at 718, and just scroll through the court's basis 718 through 722.
$718 through what?
722. This is all about the delivery of the birthday card.
Didn't we already have something like this?
I thought it was admitted into evidence without objection. Ms. Quarles tells me it wasn't.
Madam Clerk, is Exhibit 3217, pages, was it 718 through 722 in?
Not that portion.
I had the same recollection as Your Honor. Ms. Quarles told me it wasn't formally admitted.
Well, the clerk's telling me it's not in, so.
testify to this?
Yeah, we would have an objection to Ms. Beatty's email to Wendy Kowalski claiming that, well, whatever she claims,
Hearsay.
would be hearsay.
I believe she testified to this. It also goes to her action plan,
Yeah.
not to the truth of the matter. So.
Still hearsay.
Well, it would be the truth of the matter because they're trying to put this on DCF. So we object to that page. As for the email with the birthday card on 721, we don't have
This one?
no, we don't have objection to that.
Oh, yeah. Yeah, the one, yeah. Okay.
Anything else?
No, Your Honor, this was discussed. I thought we had moved into evidence. We had verified all of this with Ms. Beatty. We would ask this to be admitted.
What is the first page that we're seeking to admit?
722 is the last email. They're in sequence between 718 through 722, and 722 is the email.
Okay. So what you're asking for starting with 718?
Yes, I don't think they have an objection for 718 through 721, correct, Mr. Whitney?
If I could see 1920 again.
They're just the scans of the birthday cards.
Yeah, no, yes, right. We have no objection to 18 through 21. We object to 22.
Okay, the court's going to receive Exhibit 3217, pages 718 through 721. I'm going to exclude 722 on hearsay grounds.
Well, do we want to withdraw? Hold on.
Anything else?
Okay, that's fine. Nothing, Your Honor. Thank you.
And did we get that last exhibit that you were working on, Ms. Crowell's, with the plaintiff's team?
We discussed the redactions. I can proceed without it, and if it happens to be handed to me in the middle, I'll address it, but we can move forward.
Judge, the only issue with the exhibits, and it can be corrected before it goes back to the jury, it doesn't need to be corrected before it's shown to the jury, as they have highlighting.
I think your colleague just
Oh, you already talked about it? I
Highlighting
am behind
date's
the
over.
times, Judge.
There apparently is no highlighting date going on, so.
Okay. I defer.
Anything else before we bring in this jury?
Not the point of showing.
Defense, anything else before we bring in the jury?
don't believe so, Your Honor.
Let's bring in the jury. Okay, please be seated, everybody. Members of the jury, I want to confirm while you're away, you did not discuss this case amongst yourselves, you did no investigation and received no information. Is that all correct? Correct. Didn't see any media accounts. Is that correct? Correct. And no one approached you. Is that correct?
Correct.
Okay, Mr. Whitney, your next witness, please.
Plaintiff's call, Dr. Joseph Corcoran.
Please solemnly swear or affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth.
I do.
Afternoon, Dr. Corcoran.
Good afternoon, Mr. Whitney.
I promise this will be the last time. Let's talk.
Promises.
Let's talk about how Johns Hopkins All Children's Hospital was managed during the time of Maya Kowalski's admission. And specifically, I want to touch on how risk management was integrated into the hospital's organizational structure. Let's start at a high level. And the jury has heard some discussion of the Joint Commission. Would you reaffirm for the jury the role that the Joint Commission plays in hospital accreditation and governance?
Yes, so the Joint Commission is a nonprofit organization that evaluates hospitals and other healthcare entities on a recurring basis to make sure that they are in compliance with the regulations, conditions of participation that are really the owner's manual to how to run a healthcare facility like a hospital.
And you just mentioned conditions of participation. Are those derived from federal regulatory guidance?
Yes, they are. So conditions of participation are actually published by CMS, the Center for Medicare and Medicaid Services, and they really form the foundation or the backbone of the accreditation process.
So we have the Joint Commission, it's a private entity. We have CMS, it's a federal entity. And then in Florida, is there also a state regulator that looks at these issues?
There is. The Agency for Healthcare Administration, also known as ACA, is based in Tallahassee. They oversee licensure and regulatory compliance for the state.
Now, with respect to the governing body of Johns Hopkins All Children's Hospital, have you come to learn about self-reports of deficiencies at the governing body level to these three entities?
Yes, I have.
What have you learned in terms of self-reports to, let's start with ACA in December of 2018?
I understand that the hospital leadership, sometime around the Christmas holiday, but probably just prior to, actually went to Tallahassee to address in person issues that had been identified within the hospital that put them at odds with the conditions of participation.
Was there also a self-report to CMS?
Yes, in the week prior to Christmas 2018, ACA was also in December of 2018, but in the full week prior to Christmas of 2018, a leadership group also traveled to Atlanta, which is the regional office for CMS, and had a similar conversation with the federal regulators about shortfalls that they had been identified inside the program.
And then, given these issues and these self-reports, did the Joint Commission also become involved?
They did. And that was done through a self-report that I believe was done either electronically or in writing on or about the 28th of November, 2018.
All right. And so you had then both the federal and the state entity and the private nonprofit Joint Commission looking at and scrutinizing the hospital's management structure at that point?
Well, yes, they were looking at it from that point, but there also had been some visits earlier in the year as well.
All right. Did these issues manifest for the first time in December of 2018?
No.
All right.
My understanding is that the issues were first identified at the end of 2015, so they were not new issues.
All right. Let's walk through the timeline with some documents. So if we could please display 2811A, page 1. Dr. Corcoran, at the top of 2811, I see a header that says Agency for Healthcare Administration. Is that the Florida agency you talked about?
Yes, that's ACA.
Judge, I'm sorry, this doesn't say A, so I just want to make sure we're looking at the right document.
2811 was not redacted.
I thought you said A.
I'm sorry. My apologies. 2811. All right, we're looking at 2811, Agency for Healthcare Administration. And below the Agency for Healthcare Administration, right there, if you could keep that where it was, what is this document? It says
So-
in the top left box.
Correct. This is a statement of deficiencies and a plan of correction.
And if you could note the date on the right side there for me.
February 23rd, 2017.
And so, what's the relationship to the date of discharge of Maya Kowalski? Is that approximately a month and a half?
Yes, sir. About 6 weeks.
And this is a good view, so just keep it like this, please. And then the last two paragraphs we can see there on the left side, where were the deficiencies identified within the hospital?
In the risk management department as part of a risk management survey.
All right. If we could now display Exhibit 2815. I see CMS at the top right. Is this the federal agency you were referencing?
Yes, sir. Centers for Medicare and Medicaid Services. That's the federal regulatory agency.
And this letter or notice is dated January 31st, 2019. And who's it addressed to?
It's addressed to the interim CEO of the hospital, Dr. Kevin Sowers.
Have you come to learn when Mr. Sowers took on the position of interim CEO at Johns Hopkins All Children's Hospital?
He became interim CEO in December of 2018. I'm not sure of the specific day, but it was in December following the departure of the previous CEO.
And who did he replace?
Dr. Jonathan Ellen.
And how long had Dr. Jonathan Ellen been the CEO of Johns Hopkins All Children's Hospital?
Gosh, 6 or 7 years, if memory serves.
So Dr. Ellen would have been the president and CEO of Johns Hopkins All Children's Hospital during the time of Maya's admission?
That's correct.
And if you could zoom out a bit for me, and that's a fine view there. In the second paragraph in the letter, it references a determination of immediate jeopardy. Do you see that?
I do.
Would you please explain to the jury what immediate jeopardy is?
So, when deficiencies or non-compliance with the conditions of participation, the rule book, when those deficiencies are considered egregious, widespread, actually it's defined further down as, could you scrap that please? It's defined as an immediate or serious threat to patient health and safety. So an immediate jeopardy is as severe a finding and it carries an equally severe threat if an immediate jeopardy is not remedied quickly in a timely manner. You're given with an immediate jeopardy, you are typically required to provide an immediate mitigation plan before the survey team leaves. You then have to send a corrective action plan within 10 days and have that largely executed within 23 days. If you fail to meet that 23 days, you potentially lose access to all funding from Medicare and Medicaid.
Is it more or less a death threat to a hospital?
It is a financial death threat to a hospital, yes, sir.
I'm sorry, what's the legal base leading, Your Honor? Overruled.
Is there any classification under CMS evaluation and survey more severe than immediate jeopardy?
None that doesn't involve literally taking over the hospital.
All right. If you could drop that and then pull up the bold text there, that the 42 CFR sections for me. Now, a few moments ago, you referenced conditions of participation.
Yes, sir.
And we see here reference to the Federal Code of Regulations. Are these the conditions of participation you were referencing?
Those are 4 of them.
All right. And why are these 4 on this document?
Okay, so the immediate jeopardy was centered on 4 specific shortfalls in their exercise of meeting the conditions of participation. Governing body is the interaction of the board, which has ultimate responsibility for the entire facility, and the two primary parties, the medical staff, represented by the medical executive committee, and the administration or management of the hospital, which starts with the CEO. QAPI, Quality Assurance and Performance Improvement, that is making sure that we're staying between the guardrails and delivering good care.
I'm going to stop you there if you're.
Thank you.
All right. So if you look at these 4 things, these are the specific deficiencies that Johns Hopkins All Children's Hospital was found to have exhibited or demonstrated at this time.
These were the areas where their deficiencies were so egregious and widespread that they contributed to this immediate jeopardy. Correct.
All right. And have you had an opportunity to hear the VP of Patient Safety and Quality discuss these issues?
I did.
Who was that?
Ms. Green,
What was her first name?
Virginia?
Okay.
Is this a quiz?
Does Angela sound right?
And sure. I'm sorry.
That's all right.
I apologize to Ms. Green.
In terms of having been issued a finding of immediate jeopardy, did Ms. Green conduct a retrospective review of hospital records to see where these deficiencies should be placed and the responsibility placed?
Yes, she did.
And how far in retrospect did she look back to determine where the hospital had fallen short?
She said that one team in the hospital went back 3 years, and I believe that she took her response back 5 years.
Judge objection, hearsay.
Party admission.
Overruled.
And so, whether it was 5 years, so they're conducting this retrospective review in January 2019, receiving this letter.
That's correct.
It would take us back on the 5-year basis to January of 2014,
That's correct.
or on the 3-year basis to January of 2016.
That's correct.
In their review, without getting specific, were specific deficiencies noted in that retrospective review?
There were.
And generally, did those have to do with adverse patient outcomes?
They
Objection, Your Honor. I think we're going beyond scope.
Sustained on that one.
All right, I'll move on. Let's put up 2817, please. Now we're going to get into some of the internal communications at Johns Hopkins that surrounded
Should be 2817A.
2817A.
Sorry to interrupt.
No, thank you. Okay. So here it's 2817A. We have an email from Ms. Green dated February 25th, 2019. So this would have been just following the notification of immediate jeopardy. Is that correct?
about a month after. Yes.
And then we can see there her position at the time. What is the role within a hospital of the Senior Director for Patient Safety and Quality?
Well,
Objection, Your Honor. Foundation.
Overruled.
as the title suggests, they lead a team whose primary objective is to make sure that the care as it's delivered is delivered in a safe manner, above all else do no harm. And so they are responsible for making sure that the care is safe and the quality of the outcomes are optimized.
If we could advance to page 3 of 2817A, please. And if you could get a whole page view for page 3. All right. So I want to focus for a moment first on the subject line at the top of this email. It says, "How about this for Kevin's talking points to the board on CMS 2567?" Now, here, who is Kevin?
She's referring to Kevin Sowers, who was the interim CEO that replaced Dr. Ellen.
And the CMS 2567, is that the finding of immediate jeopardy?
CMS 2567 actually refers to the form number. Government issue forms always have an ID number on the base, and CMS 2567 is the page, the report that the findings are actually published on and made available to the hospitals.
All right. And so in the middle of the page, there's a paragraph that's short. It says there are 4 major areas we are actively working to improve. Would those map back to the 4 conditions of participation we saw a moment ago?
They do.
All right. Let us advance to page 5 of this exhibit, please. And we're going to talk specifically about the governing body and what types of issues were noted within the hospital during this retrospective review. The first bullet point under governing body, if you'll read that to yourself, and my question for you is, what have you learned about what was lacking between the message and the elevation of information between the president and the board in the previous 3 years?
So again, the board has the ultimate responsibility to make sure that everything is running as expected. It was demonstrated through this process that there was poor communication where problems were not shared appropriately. They weren't shared between, remember we talked about divisions, they weren't shared laterally, they weren't shared up. And they were certainly not getting shared to the board, so the board really was not able to do its job of overseeing the quality of care.
And then if we move down to the third primary bullet point, there's a smaller one in between, that's why I said primary. But it begins restructuring of risk management
Right.
to report directly to the health system. When Ms. Green, or Ms. Franklin, references reporting directly to the health system, what is she referencing there?
She's talking about having a direct link of communication to Johns Hopkins Health System in Baltimore. Prior to all of this, Johns Hopkins All Children's Hospital was the only one of the Hopkins affiliated hospitals that didn't have that link. In other words, at Johns Hopkins, everything was by design kept locally and was supposed to be managed locally. This gave them an opportunity and access to the expertise that is, that candidly is one of the things that Johns Hopkins is really known for around quality and patient safety. So it was giving them access to that expertise.
So just so I make sure I understand, there are several Johns Hopkins hospitals within the Johns Hopkins Health System.
Correct.
Johns Hopkins All Children's Hospital is one of them.
That's correct.
And it was discovered during this process that Johns Hopkins All Children's Hospital was the only Johns Hopkins Health System hospital where risk management at the hospital level was not reporting to the system. Is that right?
That's correct.
Then if we move down 3 from the bottom, it says the revision of the complaint and grievance process. There's been some discussion in this courtroom about the complaints made by the Kowalski family. What is the proper operation of the complaint and grievance process as it relates to risk and patient safety within a hospital?
Check your eyes beyond scope.
So a grievance actually is is recognized as having specific responsibilities. As a hospital operator, if my team received a grievance, we were required to answer that grievance within 10 calendar days. And there were, again, communication issues where grievances and complaints, like the Kowalskis shared with members of the staff at All Children's, were just not addressed at all, let alone in 10 days.
And then the last I'd like to focus to on this page is the last bullet point. It says massive education campaign on speaking up and speaking out. Have you had an opportunity to hear Ms. Green discuss this campaign?
I did.
What was the genesis of this massive education campaign?
So She described that members of the care team in a variety of positions, if they raised awareness of something not working, whether it's an outcome or whether it's a glitch, there was, number one, it was difficult to get an audience. And when you did open your mouth, she cited examples of where there was retribution against a whistleblower, a complainant. This speaking up and speaking out was a program that they put in place, kind of like see something, say something. And it was to change that. It was to encourage people to speak up when they see something wrong.
Was this because there was a culture of retaliation and retribution previously?
Yes,
Commissioner,
sir.
on a leading calls for conclusion.
On both instances.
If you could repeat your answers in case.
Yes, there was she spoke of a culture of retaliation and retribution.
Against internal employees.
That's correct. Anyone who spoke up did so at significant risk.
If we could advance to the next page on page 6, please. Here, Ms. Green or Ms. Franklin references multiple town hall meetings. Do you see that reference in the last bullet point?
I do.
Have you had the opportunity to review some video of those town hall meetings?
Yes.
What were acknowledged as several of the hospital's failures in those town hall meetings?
So the town hall meetings were hosted by Dr. Sowers, Kevin Sowers, who was the interim CEO that followed Dr. John Ellen's departure. And he was very candid about where they were falling short and basically promising to do better. He acknowledged that their shortfalls in governance were, I believe the term was, substantially contributed to prior lapses in care. He talked about why they got the IJ, what was involved, and how they needed to turn things around. He characterized at one point that Hopkins let us down. And I think he was speaking for the Johns Hopkins All Children's Hospital community when he made that statement.
You threw in the middle of that IJ.
Yes, sir.
Define what that acronym is, just in case.
Again, I'm sorry. Immediate jeopardy. That's the financial death threat that I referenced earlier.
All right. If we could advance to 2818A, beginning at page 069, please. Yeah, first one, first page. If you'll just zoom out so we can see the whole page, please. All right. Now, am I correct that this is the form 2567 that was discussed earlier?
You can see on the bottom left it says Form CMS 2567. Yes.
So this would be the document that CMS speaks to the hospital through about where the deficiencies were noted.
That's correct.
And am I correct that in the left column, on some pages you'll have more description of the deficiencies, but in the right column you'll have the hospital's efforts to correct their deficiencies?
That's correct. So the left side is where they cite in the first column, they cite the specific standard or condition of participation where the hospital is not in compliance. In the wide column to the right is where they will describe, this is the standard, this is what we saw, this is where you're not meeting expectations. And it tends to be fairly specific. To the right of that, the broad column is where the hospital writes in their plan, their corrective action plan to address that specific element of the shortfall.
And Mr. Reyes, if you would, there's two bullet points there on the right in the right column. If bold text, if you could just pull out the bold text for each of those, so we can focus on those. All right. So this first bolded bullet point speaks to the organization as it related to the risk management department. What did you learn about the failures and the ways that the hospital integrated risk management into their division level operations?
So this points out that risk management was not included in the process.
And further down in that paragraph, it references, before that bold bullet point, it says the JHatch functional org structure chart, was updated to reflect the relationship of the MEC. What is the MEC in this reference?
Medical Executive Committee,
All right. So
and they oversee the medical staff.
And so it was, at this point, having the deficiencies been noted, it was, the org chart was restructured so that risk management was properly reporting to or talking to the MEC medical staff, the president, the board. Is that right?
That's what it indicates, yes.
And then the next bullet point, if you'd read that to yourself, about no evidence of risk management reports. And describe to the jury, please, what kind of failure that indicates.
This was very surprising. It indicates that over 15 months prior to the survey, that there was no demonstrated effort to track and trend what was going on in the hospital in terms of quality. I think Dr. Perno and Dr. Napolitano both talked about tracking and trending as the key function of the risk management committee, which is different than the risk management department. And if you're not collecting data and if you're not sharing data, it's impossible to do that. So the idea of tracking and trending is if you notice something that starts to go off course, you push it back on course before it drifts way off course. So without the tracking and trending, there really were no guardrails, effectively.
If we could advance to page 72 of it's 3 more pages. Next page. And the top, that's perfect. Read that first bold bullet point to me, if you could.
Starting with according?
Yes, sir.
You want me to read it out loud?
No, I just want you to read it to yourself.
Okay.
And explain to the jury the significance of adverse medical incidents residing with the risk manager and not being elevated.
Right. So adverse medical incidents covers a variety of harms that occur in the hospital, impacting mostly patients. And so it looks like those harms or adverse medical incidents got to the risk manager, but again, they weren't shared. And they weren't shared up to leadership. Jackie Crane was over the risk management department until her departure. And there was no portal until after corrective action was put in for these to be shared at a system level. So, I mean, it's metaphorically, it's the equivalent of just being stuffed in a drawer.
And you mentioned there Ms. Crane, who was senior counsel.
She was.
And when these issues were finally discovered by the federal regulator, was she removed?
She exited at the time that Dr. Ellen exited.
Now, this document is quite detailed, and the jury will have at least 16 pages back there, so I'm not going to go through every specific deficiency. Let's move to 2819. 2819A. Excuse me.
I was ready.
All right, so here we have an email from Ms. Green, January 16th. Even before the CMS letter was delivered on January 31st, correct?
That's correct. This is dated January 16, 2019.
And it's addressed primarily, or at least first, to Mr. Sowers, the interim CEO.
Correct.
All right, and then she attaches, let's go to page 2 of this, please. She attaches the hospital's anticipation of what's coming and how they're going to rectify the situation. So let's go to page 3. And we've seen these terms in, let's say, federal regulatory agency speak, but here they are in the hospital's words. So we're just looking at the focus area of governance and the 2 primary findings there. Would you speak to those? Let's start with over-reliance on department-level case review. Would you please explain what that means?
Right. So recall that the Department of Pediatrics had 15, and at this time I believe they had actually 20 divisions reporting up to it. So the Department of Pediatrics, which is pediatric medicine, managed 15 to 20 different divisions, and then the Department of Pediatric Surgery managed all of the surgical subspecialties. And so they in this governance structure, they created parallel systems for quality assurance and performance improvement. And so, again, they were kind of left to police themselves.
And the second one there, issues did not flow freely to the board. You've spoken about that a little bit earlier. Is there anything to add?
No, again, if the board is accountable. If something goes wrong, the board has its feet held to the fire. But as we've seen elsewhere, if the information is not flowing in and they're not able to pull the information up, they can't do their jobs.
And then we get to the second focus area, which is culture. And it references the fear of retribution with speaking up that you mentioned earlier.
Yes, sir.
How does hospital culture manifest at the patient level?
So,
Objection, Your Honor, beyond scope calls for speculation.
Overruled.
so culture starts at the top, and one of the elements of just culture, which is actually a formal program. One of the elements is that you really want to think about what's best for patients. And it acknowledges that mistakes can be made, and it tries to differentiate between I made a mistake or I knew it was wrong and I did it anyway. The focus on culture as the patient sees it, that's really the patient experience. Are my needs being met? Do I feel like I'm being listened to? Are people advocating for me? You know, Maya was 10 years old, celebrated her 11th birthday at the hospital.
Let me interrupt you for a question
Please.
before I get an objection.
Sure.
You mentioned an advocate. What is the concept of a patient advocate within a hospital?
Well,
Objection, Your Honor, beyond scope. Overruled on that one.
a patient advocate is somebody who is keeping an eye on all the moving parts. You know, there's a lot of focus on what the doctors do, appropriately. But there's an awful lot of people that have to do their jobs well if that care is going to hit the target. And so an advocate is someone who is kind of watching all the inbound aircraft and making sure that they're aligned for what's best for the patient.
Is it true that a patient advocate would be someone that would be present with the child over the course of their admission?
Leading.
Not side by side. I'm sorry, Judge.
I'm going to sustain the leading.
Have you observed the different and had an opportunity to watch the testimony of the different witnesses that the defense presented here?
Many of them, yes, sir.
Did at any point you see someone who claimed to be the patient advocate for Maya Kowalski?
Objection, Your Honor. Relevance calls for conclusion. Calls for argument. Overruled.
Somewhat surprisingly, no. We heard a lot from members of the teams, the medical team, the social work team, the risk management team, and there was a lot of team management talked about in how Maya's care was delivered. But I don't recall hearing from anyone that was really playing guardian angel, somebody who was really looking out for Maya and her care.
If we could advance to page 5. And this is the last one we'll speak to in this hospital presentation. Disclosure and communication with families. And then it says inconsistent practice and documentation after adverse events. Would you please explain this concept in the context of hospital management and the importance of communication with families?
Objection calls for argument and for a narrative.
Overruled. You can answer.
Thank you. So, I tell my doctors and my team, when I was in the role, I told my doctors and my teams, if you make a mistake, own it, just like I tell my kids. So disclosing, hey, we made a mistake, is considered an important first step in communication and regaining trust that can very easily be lost if a mistake is made or if outcome is not what everybody intended to get. So inconsistent practice means that there was no endorsed or encouraged best practice for all of the divisions and ultimately the departments to follow.
Through your observation of the testimony here, including that of Dr. Jennifer Katzenstein, has it come to your attention that Jack and Beata Kowalski attempted to communicate their concerns with the hospital?
Objection, Your Honor. Based on province of the jury's calling for editorial comment on the testimony.
Sustained.
We can take that down. Based upon your background training experience and to a reasonable management probability, do you believe that the deficiencies that we've discussed here caused or contributed to the patient experience and the harm done to Maya Kowalski?
Objection, foundation.
Overruled.
Without question, the gaps in the function of the governing body, again, Dr. Sowers said it was a contributing factor in previous lapses. I have no reason to counter that opinion. It's undoubtedly true that they contributed.
All right, nothing further this time.
Mr. Hunter, are you?
Yes, sir.
It's not me.
Good afternoon, Dr.
Good
Corcoran.
afternoon, sir.
You were provided a number of documents regarding various surveys, correct?
I saw several documents that involved surveys, yes, sir.
Were you given a set of documents regarding a Joint Commission triennial survey from September of 2015?
I saw the summary of it, yes, sir.
That resulted in the Joint Commission accrediting the hospital, did it not?
In 2015, yes, sir.
All right. And that accreditation was good for the following 3 years unless it was revoked, correct?
That's correct.
All right. And did you also see a survey, and incidentally, these surveys are fairly arduous events, are they not?
Typically, you've got 3, 4, maybe 5 surveyors on site for 3, 4, or 5 days, yes, sir.
When you were at Brandon Regional Hospital, did you handle those?
I was absolutely involved in every day that they were on site.
very searching review, correct?
They were stressful, yes, sir.
All right. They went to all aspects of the hospital, correct?
They did.
All right. So when they did that at Johns Hopkins All Children's Hospital in September of 2015, they reaccredited the hospital, correct?
Yes, sir.
And then in 2016, they did a follow-up random review. You saw that, did you?
I don't. Could you refresh my recollection on that, sir?
Sure. Wasn't there in March of 2016 a follow-up review of evidence of compliance with the accreditation they had been granted the year before, in March of 2016?
Objectionable for improper way to refresh recollection.
Right, if you're going to refresh his recollection, why don't you show him the document?
Let me get that pulled up, Judge. Let me ask a couple questions first before I do that. Excuse me. You were present during Ms. Green's deposition the other night, right?
I was there. Yes,
And
sir.
were you provided a copy of the review done by the Joint Commission in March of 2016?
Mr. Hunter, I can't say with certainty that I was. It was Parents' Weekend at my son's college, and I was up in Gainesville. So I played dad instead of expert witness this weekend. I can't tell you which documents, off the top of my head, which documents I saw and which I did not. I certainly did not see but a small fraction of what was turned over.
Okay. Well, did you see a risk management survey that was done by ACA in February of 2017?
Again, I'd like to have my recollection refreshed. I don't recall which ones I've seen and which I didn't see.
Did you
Just-
see?
Just hand him the document if you.
Judge, I'm sorry that there's a stack of documents that would gag 3 billy goats and a maggot about this tall.
I don't
that I'm
understand what
having
that
to-
means.
Well, it's a lot of documents, and I don't have at my fingertips the ability to grab that particular document. I had it.
Do we need to take a few minutes so you can organize?
It would be very helpful, Your Honor.
Why don't we take 5 minutes? Members of the jury, do not discuss this case amongst yourselves, do not do any investigation, and receive no information. All rise. The jury is out of our presence. Doctor, you're in the middle of your testimony. Do not discuss this case with anyone. Mr. Hunter, do you need 5 minutes, 10 minutes? How much
10
time?
minutes would be fine, Judge.
I'm sorry?
10 minutes would be better, Judge.
Okay, we'll be back in 10 minutes, but remember we have timing issues with a witness, so.
Yes, sir.
Okay, 10 minutes.
Yes, sir.
Ready to go?
Yes, sir.
Let's bring back the jury. Please be seated, everybody. Members of the jury, I want to confirm while you're away, you did not discuss this case amongst yourselves. You did not do any investigation and receive no information. Is that all correct? Correct. No one approached you about this case. Is that correct? Correct. And you didn't see any media coverage. Is that correct? Correct. Mr. Hunter?
Yes, Your Honor. May I approach the witness?
You may.
Dr. Corcoran, I've got a accreditation report here from
Thank you.
March of 2016. Have you ever seen that before?
I don't believe so.
So, you've never reviewed what I just showed?
I don't believe I've seen this particular report. Yes, sir.
Your Honor, may we approach for a moment?
Sure.
So the jury's aware you were provided a number of documents, or you attended a deposition Friday night.
I did.
Okay. There are a number of documents that you got to see as a result of that, correct?
Yes, sir.
Okay. The one I just showed you, you said you'd never seen before.
I don't recognize it. It may have been introduced, but I don't recognize it.
Well, my question to you is, do you have any reason to question the proposition that in March and April of 2016, a joint commission survey occurred unannounced at All Children's Hospital and their accreditation was affirmed?
Objection. Counsel testifying.
Overruled. You can answer.
I'm sorry, can you repeat this question, please?
Yes, sir. Do you have any reason to question that in March of 2016, followed up in April of 2016, a joint commission survey took place at Johns Hopkins All Children's Hospital and that their accreditation was affirmed?
So I have no reason to question you, and that if accreditation was renewed in 2015, then unless there were a flagrant violation, accreditation would not really be on the table at that time.
Well, wouldn't there be occasional random follow-ups to accreditation inspections?
Short answer, no. Most of the time, Joint Commission returns to a facility in response to a complaint or awareness of some kind of a problem.
So you've never heard in your long experience of random surveys taking place after an accreditation in the preceding year or so?
Objection. Argumentative.
Overruled.
There can be follow-up surveys. When the accreditation survey is done, then CMS actually audits the work of the Joint Commission and will come in and do, I'm blanking on the term for it, but they will basically come in and affirm that the Joint Commission survey is accurate.
Okay. The document I just showed you was a Joint Commission survey, correct?
I believe so, yes, sir.
And you have no reason to question that it affirmed the accreditation?
Well, I don't think that was in the time frame. Typically, CMS comes back in 45 days or less. So I don't think that's the kind of survey that I was referring to, sir.
All right. Well, let's go with this another way.
May I, if you'll show me the document, I'm happy to do a quick review of it.
Well, I'll be happy to show you this and the two subsequent follow-ups from these compliance documents.
Just the three, or is that it?
This is a different one.
Okay. Can you give me a minute to look at them?
Sure.
Okay.
Perhaps, Mr. Hunter, you could return to the lectern.
So on the survey done March 7th, which was unannounced by the Joint Commission, they found elements of performance where there was insufficient compliance. Social work consult for a patient on suicidal precautions was not performed until approximately 9 hours after. There was another element of insufficient compliance that related to utilization of moderate or deep sedation or anesthesia.
And were there, excuse me, were there indications of a follow-up that established compliance?
I'm looking for that in the next visit, sir. I just want to match up the ECLD. So this visit that was approximately a month later is a survey addressing different elements of participation, different standards.
And it indicated compliance.
This shows compliance. This still has some outstanding issues.
And then there's a subsequent that shows that was placed in compliance, correct?
One second, sir. So this survey dated 4/22, which is the 45-day evidence of standards compliance, does show compliance with the anesthesia-related fallout, but not the leadership one. And this one, dated May 3, the 60-day visit, does show LD 040105 is now compliant. So from March until May, they had issues and they corrected them.
And that's fairly typical of Joint Commission surveys, is it not?
Yes, sir.
Happened in your hospital, didn't it?
Many times.
And incidentally, there's a number of ACA inspections of your hospital, correct?
ACA is a frequent visitor to most hospitals, sir.
Okay. Frequent visitor to Brandon Hospital, correct? For complaints and otherwise.
I will tell you, during my tenure, they were frequent but not overwhelming.
Now, isn't it also true, sir? Well, let me just ask it this way. You were given a report of an unannounced accreditation survey by the Joint Commission of Johns Hopkins All Children's Hospital in August of 2018.
Unannounced in August of 18, wasn't that when they had their re-accreditation visit?
Yes, sir. Yes, sir.
And there was a second visit
Yes, sir.
the same month?
Yes, sir.
I don't believe I saw that one.
Okay. But those visits resulted in reaccreditation, did they not?
Not the second visit. That's not a reaccreditation. They were reaccredited in August of 18,
Okay?
but that was their triennial review. Yes,
Okay.
sir.
So the point I'm making here is that in August of 2018, there was a triennial reaccreditation survey done by the
Right.
Joint Commission that resulted in reaccreditation, correct?
Right, and all of the violations were on the safer matrix in the lower, less frequent quadrant.
That's where you want them, right?
Amen.
Okay. So in August of 2018, the 3-year accreditation that was issued in September of 2015 was continued, correct?
Somewhat surprisingly, yes.
All right. Well, editorial comment aside, it was continued, correct?
Well, again, given the presence of ACA joint CMS starting in April of that year, yes, they got away with a remarkably benign evaluation,
Okay.
and it was in fact
And it indicates
reaccredited.
effort on their part to do that, correct?
Okay.
Incidentally, were you provided information regarding a CMS survey of all children's in May of 2017?
Again, can you show me the document? So I
Sure,
can
I'm showing
refresh?
the witness trial exhibit 2823-001, marked by plaintiff.
Yes, this was a visit specific to the pharmacy.
Showed compliance, correct?
I believe there were no issues identified on that visit.
Okay. Now, let's talk for a minute, if we could, about some of the reports that council walked you through. Let me first direct your attention to trial exhibit 2811. You could put that up, please. I'm not sure we need to see the details of it, but was there any indication in that report, and you reviewed this, right?
I did.
Okay.
This today.
Okay.
Yes, sir.
You testified about this a few minutes ago.
I did.
For council.
Yes, sir.
Okay, so were you aware of any joint commission survey of the hospital being done at the same time or around the same time as this particular report?
I'm struggling to answer clearly because there were so many surveys. Candidly, Mr. Hunter, keeping ACA from CMS is a challenge given the short timeline and my cursory review of just a part of the documents that you shared.
Well, let me show you what I'll represent to you as a joint commission correspondence to Mr. Sowers dated February 25th, 2019. We ever shown that?
Yes, this is a letter that documents the acceptance of the conditions of the plan for corrective action from the IP. Is that correct?
I believe you'll see
From the
that-
IJ. Sorry, the immediate jeopardy.
I believe you'll see that that indicates that there was a survey done by Joint Commission at or about that time that resulted in a finding of compliance.
Yes, the services at your hospital were found to be in substantial compliance.
That was a Joint Commission survey that occurred, correct?
And that was done 1 month after, or 23 days actually, after the IJ. And 23 days is kind of that magic window that if you're not in compliance by then, you are at risk for losing your funding.
I'm glad you brought that up. So the IJ was issued by CMS, correct?
Correct.
All right. This is the Joint Commission.
Right?
They're not the same thing.
They're not.
Okay. So the Joint Commission found that there was substantial compliance, and the CMS was in the process of following up on the IJ, correct?
So it gets even stickier because the CMS surveys are typically handled by ACA surveyors.
Okay. Well, whoever was doing that, they lifted the IJ at about this time, February 25th, did they not?
They lifted the no. What they did at that time was that they accepted the corrective action plan. The IJ threat was still in place until, I believe, late May or mid-June of that year. And in fact, the hospital requested and was given 2 extensions to comply, and then ultimately had signed an agreement, a binding agreement with the federal government that it would accept having a consultant in the facility for the next 12 months who would oversee or direct the compliance. And in exchange, the federal government takes the threat of losing funding away.
But the IJ was lifted.
Again, they accepted the plan of correction.
Correct. And lifted the IJ as a result, correct?
No, sir, because again, they were still under threat of being removed from funding until late May or early June.
But at that point, the IJ was ultimately lifted, correct?
At the end of June, yes. I'm sorry. I thought you were asking about that February date.
All right. So we can agree the IJ was lifted.
With an asterisk because of these
And we
extraordinary.
can agree that there was substantial effort put forth at compliance.
Oh, absolutely.
All right.
The new team actually did well.
Okay.
They worked hard.
Well, let me come back to that in a minute. In this 2811, where is the reference to nursing service?
This survey was conducted in conjunction with a risk management survey.
That's all. Just risk management.
From what you're showing me, yes, this is a risk management survey.
All right. Where is the reference to risk management activities in the fall of 2016?
There's nothing specifically mentioned about 2016 in this unannounced complaint investigation.
Now, there was talk about trial exhibit 2815. Let me ask you, get that up if you could, Clay. And you talked about 4 areas that it addressed. And this is the announcement of the IJ in January of 2019, correct?
January 31, 2019, yes, sir.
Okay, and that's January of 2019 is about 2 years after Maya Kowalski was discharged, correct?
That's correct.
All right. Now, in this statement of the grounds and the findings that are based on the IJ, that were the basis for the IJ, where is the reference to the nursing service?
It's not in this letter. It's in the CMS 2567.
By all means, do you have that handy?
No, sir.
Okay. Well, in this letter here, is there anything basing the action on the hospitalist service?
Medical staff,
Medical staff in general,
right?
no specification to the hospitalist service.
Not in this letter. Again, this is the overview, not the detail.
Okay. So the detail is in the 11119 form
2567.
2567 in the lower left-hand corner.
Yes, sir.
Okay. So you looked at all 100 and some odd pages of this?
I did not see the version with the corrective action plan. I looked at the original document, which was 49 pages.
Okay. And I may have that in my hand too. I just can't tell the weight of these things.
Fair enough.
But I was curious, in looking at this document, did you see any specific reference to the PICU intensivist service?
The intensivist physicians were not specifically mentioned. No, sir.
Nor were the hospitals, correct?
To my knowledge, no, sir.
All right. And you didn't see any reference to the pain management service either, did you?
No, but again, the issues that were cited are the ones that support them and also oversee them.
They
right?
oversee them, but we're talking about them themselves, the people.
Yeah, and it's
not
unusual.
the structure of the people.
I understand your question now. It's unusual for specific physicians or specific medical groups to be identified in these kind of surveys.
And in that survey, did you see any reference to what was happening on the 7th floor, the medical surgical unit, in October of 2016?
Well, again, no, because the survey is not geared to follow specific physicians, physician groups, and their individual practices. That's a job that falls to the medical staff led by the MEC, and that's what was called out here. So more.
Well, there's specific examples given for most of these things. And so what I'm trying to find out is, did you see in this report, in the original report that put in place the IJ, or was the basis for what was put in place as the IJ, did you see any reference to the events of October, November, and December of 2016?
Specific to those dates, no, sir.
And you saw no reference to the psychology service specifically, did you?
That's correct.
And you saw no reference to the psychiatry service, did you?
For those dates, no, sir, you're correct.
Now, there was reference to your discussion of Trial Exhibit 2817. A. Excuse me. See, she does it to me too. It sounded to me like you were saying that the problem, or one of the problems addressed
Can you put
here
that
was-
document up, sir?
Oh, sure. Can we put that up? I just got a couple of questions about it.
Sure.
First of all, it indicated they were working to improve the situation, right?
Yes.
Okay. And in some of the documents you made that we were referenced here, specifically 2821A, you weren't asked about that one.
I don't recognize it by number.
2821A in evidence. You can put that up. Let me finish. It's too quick for me. Let me just ask you first of all, before we leave 2817. It sounded to me like what you were concerned about in this document was the extent to which risk management was not reporting upward.
That was one of the talking points that they developed for the interim CEO to address with the board.
And they were trying to...
Was sharing of information, correct.
Okay. So information wasn't getting shared by risk management. Right?
That's the inference from their talking points.
All right. So let's go back, if we could, to what I was referring to a moment ago, 2821. This is a letter dated 10 February 2019 regarding the statement of deficiencies, right?
Yes, sir.
Okay. And this letter indicates, does it not, that efforts to address what later became the basis for the IJ had already begun by the time of the inspection, correct?
That's incorrect. This is February 10 of 2019. The survey was 10 days earlier. This is the response to it.
Understood. This is the response to the inspection report from January 11th to January 7th to January
7 to 11.
And this was on time, submitted within 10 days, correct?
From the January 31 report back. Yes,
Right.
sir.
And this letter summarized efforts that were being made to address the IJ concerns, correct?
It does, and as I said, the new team actually worked really hard. It was too late to help Maya, but this was good work.
It was, the new team was already in place by the time of the inspection, correct?
They were assembling. I think Ms. Green actually took her role 3 or 4 days before 12 inspectors, surveyors arrived. But yes, sir, they were assembling. They were mustering.
Well, the executive team was already in place and already addressing these concerns by the time the inspection team arrived, correct?
I can't speak to the entire team. They had 8 departures in leadership, so I don't know that all 8 spots were backfilled, but I do know that there was an interim CEO in place. Regarding the other 7 positions, I have no idea when they were
You've shown
filled.
us his talking points and the efforts that were being made to address the situation, correct?
Following the survey, yes, sir. And he was also one of the, per Ms. Green, he was also one of the attendees at the visits to CMS in Atlanta and ACA in Tallahassee.
May I have a moment, Your Honor?
You may.
I think that's all I have. Thank you, sir.
Mr. Whitney.
Since your weekend plans are now in front of the jury, you went to the Florida football game on Saturday.
You didn't have to remind me, sir.
I thought the black uniforms were going to work, but no.
Well, we lost.
All right.
That's all I'd like to say about it, sir.
Sure. And you spent Friday night with me and Mr. Hunter at a deposition of Ms. Green.
I did.
And how long did that last?
We sat down at about 4 o'clock. I want to say we left the building somewhere 7:30, 7:45.
Before that deposition, had you ever seen the first corrective action plan from Johns Hopkins All Children's Hospital?
Not to my knowledge, no.
And just so that your diligence is not in question, first of all, we left with a stack of papers, did we not?
A box full, yes.
Your Honor, relevance to be honest with you.
Overruled.
We left with a box full of papers.
Yes, sir.
And you did not spend your weekend reviewing everything that was provided on Friday night, did you?
No, sir. As I said, I was a dad this weekend.
And then 2 more boxes were provided to us over the weekend.
That's what you told me, yes, sir.
So the fact that you haven't seen a particular survey is not a reflection of your diligence, is it?
I hope not.
Okay. Now let's talk about surveys. That's what they are, right? A
They are.
survey.
They are.
And these folks that come from whether it's the Joint Commission or CMS or ACA, they're in their hospital for what, a week?
They can be there. Typically, they run 3, 4, or 5 days. Now, a complaint survey can be in and out in a matter of hours or a day. But when they're full surveys, they're multiple days with multiple surveyors. And typically what they'll do is, for an accreditation survey, for instance, they will bring an engineer to look at the heating and cooling, to look at all the mechanicals, the elevators. They'll bring nurses in to look at nursing things. They'll bring in pharmacists to look at pharmacy things.
The short answer is they're there for a brief period of time in any hospital during a survey.
It feels like forever, but they're typically there for 3, 4, or 5 days.
All right.
And with the CMS survey that was done January 7th through the 11th of 2019, my understanding is that there were 12 surveyors.
All right. In the intervening 3 years between an accreditation or a reaccreditation, the Joint Commission folks or the CMS folks or the ACA folks, they don't live at the hospital, they don't reside at the hospital, they're not there every day, right?
You try to keep them at bay.
The system, as it is reliant on self-reporting, is it not?
It's encouraged, for sure.
It's reliant on the hospital that's being evaluated being an honest actor.
Correct, and there are some specific fallouts that require timely notice. For instance, an adverse event requires a Code 15 filing if it's severe enough. And so that needs to be, Tallahassee needs to be notified ASAP.
And in this instance, was it discovered that Johns Hopkins All Children's Hospital was not self-reporting adverse events in a timely fashion?
Objection, Your Honor. We all scope rolling.
I'm going to sustain that one.
Understood. This was all the genesis of an eventual self-report by Johns Hopkins All Children's Hospital, right?
Objection, leading, Your Honor.
Overruled.
The survey that ultimately led to the IJ, which was backdated to 4 or 5 months earlier, did involve self-reporting.
What drove that self-reporting?
Objection, Your Honor. False speculation by the witness, like foundation.
Overruled.
There were several issues at the hospital that were well documented by local press that actually ended up being a finalist for the Pulitzer Prize for investigative journalism.
Objection, Your Honor. Move to strike, not responsive.
The jury's going to disregard the comment about the Pulitzer Prize.
Sorry, Your Honor.
Could we approach, Your Honor?
I'm done with that line of questioning. Having observed the trial here, have you seen or heard any testimony from anyone with the title of vice president or above from the hospital to explain that they had this all under control during 2016 and 2017?
Objection, Your Honor. May we approach?
Sure. Objection sustained.
think I'm going to leave it there for now, Dr. Corcoran. Thank you.
Anything further, Mr. Hunter?
No, Your Honor.
Members of the jury, do any of you have any questions? Hey, members of the jury, I'm not going to ask the question that was posed, but Mr. Whitney will ask questions, then Mr. Hunter will have an opportunity to follow up.
The 2019 immediate jeopardy finding and all the corrective actions that were performed by Johns Hopkins Ultramar Hospital. Is it a fair, well, first of all, there was a retrospective analysis that led to this. Is that right?
Objection, Your Honor. He's leading.
Overruled.
Right. So, yes, they look at what led to the problems. If you think about it as a firefighter shows up, puts out the fire, but looks at whether the electric panel has any issues, whether there's carpet in front of the a portable heater. They look for the causes of what allowed the problems to show up.
And is it accurate summarization of your testimony to say that the issues that, as they're contained in that dense federal document, surfaced as early as 2015 within the hospital?
Yes.
Objection, leading, Your Honor, and also argumentative.
Overruled on both.
Yes, there were 4 or 5 pediatric cardiac surgery.
I'm going to remind you of the instruction.
Sorry. There were 4 or 5 PAs in the operating room who had concerns.
Objection, Your Honor.
Let's not go
Let me
into
ask the
details.
question. Let me ask another question.
The
Let me ask the question.
Okay.
Sorry. We're testing you. Were there self-reports at the employee level in the hospital dating back as early as 2015 of issues with patient care?
Objection to predicate foundation. Judge Beard, approach.
Approach. other questions, Mr. Whitney?
Not this time, Your Honor.
Mr. Hunter, any other questions?
No, Your Honor.
Members of the jury, any other questions from the jury? May this witness be excused.
Yes, Your Honor.
Yes, Your Honor.
Thank you, sir. Thank you for being here.
Thank you for your consideration of getting me to the doctors.
Plaintiffs, any further evidence in rebuttal? So at the time, is the plaintiff's resting?
We're resting in rebuttal.
What we're going to do, members of the jury, we're going to give you probably 10 or 15 minutes. I'm going to be talking jury instructions with you when we come back. It's just going to take a while, so just steel yourself that you're going to get to listen to me give a lot of instructions. So if you need to use the restroom or whatever, that's fine. Do not discuss this case amongst yourselves. Do not do any investigation and receive no information. Let's take 15 minutes.
All rise. Jurors exited.
Okay, the jury is out of our presence in a moment. We'll go on a break. I was going to have, Mr. Reyes, you're going to be the one that is putting these up as I speak, or is that going to be Mr. Cottrell?
Your decision, Your Honor.
I just need one of you to do it. And I just need, you want it in a PDF format, is
Yes, Your Honor.
that? Okay. So it will be re-emailed out to the lawyers in a PDF format, and so if the lawyers can get it to whoever is going to be putting it up on the public gallery boards. I'll also bring in the paper versions as well. Mr. Elegant gave us a couple of verdict form changes. I made those. I'm so sorry?
Those are the only things that we know.
Knock on wood. So let's take 15 minutes, and then we'll come back, and I'll start reading jury instructions, and then it's my intent to send the jury home after that.
I'm sorry, you say you'll have a paper copy for us?
Yes, they I think are now finished printing.
Okay.
So I will have them when we come back.
The plaintiffs renew their motion for the court to instruct the jury concerning the circumstances that unfolded this past weekend. As this has turned out, the defense has managed to pull a delay of key documents for 5 years into a methodology for getting exactly what they wanted in front of the
Mr.
jury.
Anderson, if there's something you want me to consider, put it in writing, give me something specific, otherwise...
I will judge you.
Okay. I'll be back in a few minutes.
All rise. Scores in recess.
Somebody from the plaintiffs come. Somebody from the defense come.
I'm right here.
Oh,
Can you show it? Thank you. 30, 20.
that's how punchy we are.
Now, with respect to the dependency court order package, they're still being copied. I wasn't planning on reading them unless the parties wanted me to reread those instructions. I was just going to give it to them. I can do it today, or I can hand them those tomorrow. I am indifferent on the timing.
Did you mean to give me this, Judge? It says jury.
No, you don't get the juries.
Yeah.
Sorry about that.
You got it?
Your Honor, if there's time, I would like to have it read one last time.
I'm sorry?
If there is time, I would like to have the defense orders read one last time.
You can take a couple minutes and look at it.
I'm trying to come up with a proposed order, which I can. And are we going to go over, yes, we are on the verdict form.
No,
Because
no.
I have a concern.
You're not reading the verdict form today, Judge.
No, the verdict form would be discussed tomorrow.
Okay.
I would go over it tomorrow after closing arguments. Because I think that's in the last instruction.
Mine was, I'm still on.
Yeah, on page 68 of 68 is where we would be going over the verdict form, which will occur tomorrow.
I just had an addition to paragraph 41 in light of the circumstances.
To the verdict form or to the jury instructions?
Oh, to the verdict form. The fraudulent billing,
Well,
Mr. Kowalski, needs to include.
why don't we deal with that after we send the jury home today, if I'm not going to be reading the verdict form today?
Absolutely.
Judge, you included a pack, in the defense packet, there was one that's not double-sided. Was that for you?
Well, that's actually for you. Mr. Hunter suggested you might not want a double-sided copy. So,
I love you, baby.
Thank you.
so that's for you, Ms. Crowells.
Thank you.
So on the dependency court order instruction, do you want me to hand it out today, tomorrow?
Our preference is tomorrow.
Tomorrow.
Let me guess, today? Okay. We have an agreement. I'm rolling with it tomorrow. Madam Court Reporter, you're welcome. I will have probably about 10 minutes of comments tomorrow morning before we bring in the jury. So I'm trying to figure out what time we need to start. If the jury is able to come at 8:30, if we start at 8:15, is that going to be enough, or do we need more time for any last-minute issues?
We're going to have some time out today after the jury leaves, right, Judge?
Yes.
If we
That
can
night,
get to
next
9.
time is fine.
About last minute issued out.
I can't hear you, Mr. Hunter.
I'm sorry, Your Honor, I'm about last minute issued out.
Just in terms of timing, the court envisions that the plaintiff would put on their closing argument, the defense would do theirs, plaintiff would do their rebuttal, and hoping to get all that in before a late lunch. Is that optimistically what the court schedule would be?
I would love to be able to do it. I'm probably going, and I'm just telling the court deputies this for the first time. My thought is that they will, in the morning, get the jurors' lunch orders. And so they can have lunch ready to go, that we will just take mid-morning breaks and not take a lunch break. And as soon as we send the jury back, the lunch will be ready for the jury and they can just dive right in.
The only issue in that, Judge, is you're doing 12 orders.
I'm sorry?
Are you doing 12 orders?
Well, what we do is we take 12 orders, but we don't call in 12 orders. Yep. That, we are good stewards of the public's money. We don't order extra lunches when we don't have to.
That's harsh.
Mr. Altenberg, are you ready for me to proceed, or do you still need a few more minutes? Plaintiffs, are you ready for me to start reading?
I just have, if I could approach, I have this instruction to look at it.
Can you pull up whatever he's going to hand me?
What version thereof?
Are you waiting for a response, Judge?
I'm waiting for a response from the defense.
Well, to a large degree, I think this has already been handled by what's gone on in the last couple hours. It's not really written like an instruction and talks in terms of exploitation and tells you you should not consider any questions regarding the alleged failure of Dr. Corcoran to review certain documents informing his opinions, nor an evaluation of Dr. Corcoran's opinions. Or that also was handled during the examination to explain when all this was done. This is basically things that the lawyers have already handled, and I don't see that it needs to be a special instruction, nor am I quite sure where it would be placed.
Here's my view. I don't think I'm going to give it at this point in time. I mean, certainly if the defense makes a point about this in the closing arguments, then I probably will have to give an instruction on it, but I suspect it's not going to be commented on in closing arguments.
Got a lot to cover in closing.
The testimony that was already adduced will suffice.
Thank you, Your Honor.
I understand the court's ruling.
There you go, Madam Clerk. Let's bring in the jury.
All rise. Jurors entering.
Okay, everyone please be seated. Then Coley. One for each juror member, please. Who's turn? Okay, members of the jury, before I start to read, I want to confirm that while you were away, you did not discuss this case amongst yourselves, you did not do any investigation, and you received no information. Is that all correct? And no one approached you about this case. Is that correct? And you saw no media accounts about this case. Is that correct? Okay. Now, members of the jury, that 68-page package I just gave you are the jury instructions that are going to be applicable to this case. I am going to read those instructions to you at this point in time. It's going to take me a little bit of time. You are free to listen to me or to read along or both. If I'm doing this properly, I'm also going to publish it on your monitors as well. And looks like Mr. Reyes is helping me out there. Thank you, Mr. Reyes. If I end up reading too quickly, just flag me down. If I mess up how I'm reading it, I'll probably just reread that little section. And every now and again, I'll take some water. Okay. And just to orient you, what we have done is on pages 2 and 3 of the jury instructions, we have listed out the claims and the issues and created a table of contents for you so that you will be able to more quickly find the specific instructions. And additionally, when we send back the evidence to you, we'll also have kind of like a table of contents of the evidence as well that you will have available to you. So, without further ado, let's go to page 4 of 68. Members of the jury, you have now heard and received all of the evidence in this case. I am now going to tell you about the rules of law that you must use in reaching your verdict. You will recall at the beginning of the case, I gave you a short explanation of the claims in this case and told you that I would provide a complete written set of instructions before you deliberated to reach your verdict. These instructions are the complete set of instructions that you will use in the jury room. When I finish telling you about the rules of law, the attorneys will present their final arguments, and then you'll retire to decide your verdict. The final arguments will occur tomorrow. As a reminder, I previously instructed you on all relevant dependency court orders binding Johns Hopkins All Children's Hospital, and I will be separately including those instructions for your review and use during your deliberations, and I'll give those to you tomorrow. As a further reminder, I also previously instructed you that Johns Hopkins All Children's Hospital does not have any immunity from the claims presented to you in this trial. As you understand by now, Jack Kowalski is the plaintiff in this case in 3 separate capacities. First, he claims damages for his daughter, Maya Kowalski, because she is under the age of 18 and is a minor. Second, he asserts claims for his deceased wife, Beata Kowalski, Beata Kowalski's estate, and Beata Kowalski's legal survivors as the personal representative of her estate. Finally, he claims damages personally on his own behalf. In these instructions, when a claim is made for Maya Kowalski, the instructions will describe Maya Kowalski as the claimant, even though legally Jack Kowalski as her father is the plaintiff. When Jack Kowalski is making a claim in his capacity as the personal representative of the estate of Beata Kowalski, the instructions will describe the estate as the claimant. Finally, when the claim is for Mr. Kowalski personally, the instructions will describe Jack Kowalski as the claimant. In these instructions, there are instructions for, and it should say 7, not 9, I apologize, 7 separate claims. These instructions are given to you in writing to use in the jury room, and they include a table of contents so that you can find the instructions for a specific claim quicker during your deliberations. Although these claims have been tried together, each is separate from the other, and each party is entitled to have you separately consider each claim as it affects that party. Therefore, in your deliberations, you should consider the evidence as it relates to each claim separately, as you would had each claim been tried before you separately. During this trial, you have heard evidence about rules or policies created by Johns Hopkins All Children's Hospital for its employees and for visitors. You have also heard evidence about a document described as the Patient and Family Rights and Responsibilities, or as a Patient's Bill of Rights. The fact that an employee may have failed to comply with these requirements is not a violation of a law or a breach of a legal duty. It is only evidence that may be considered by you to determine whether Johns Hopkins All Children's Hospital breached one of the legal duties or standards of care that I explained to you in these instructions. Likewise, the fact that an employee may have complied with these requirements does not mean that Johns Hopkins All Children's Hospital cannot be found to have breached one of the legal duties or standards of care that I explained to you in these instructions. Again, that fact is only evidence that you may consider to determine whether Johns Hopkins All Children's Hospital did not breach one of the legal duties or standards of care that I explained to you in these instructions. During the trial, you have heard testimony about whether Mr. Kowalski was prohibited at times by the dependency court from authorizing a doctor to administer ketamine to Maya Kowalski. When the dependency court entered the order on January 13th, let me just read that again. When the dependency court entered the order on January 13th, 2017, which discharged Maya Kowalski from the hospital and placed her in the interim care of her father, the dependency court prohibited Mr. Kowalski from authorizing a doctor to administer ketamine to Maya Kowalski. On April 20th, 2017, the dependency court entered a final order releasing Maya Kowalski from shelter status. That order ended the lawsuit in the dependency court and all existing orders. During the trial, you have heard testimony that Maya Kowalski experienced stress relating to this current lawsuit. Emotional stress that parties to a lawsuit experience because of their involvement in the lawsuit is not an element of damages for any claim in this lawsuit. Claim 1, false imprisonment. The first claim in this case is brought by Maya Kowalski against Johns Hopkins All Children's Hospital. Maya Kowalski claims that Johns Hopkins All Children's Hospital intentionally restrained Maya Kowalski on 3 separate occasions under circumstances that were unreasonable and unwarranted and without legal authority, which caused her harm. First, Maya Kowalski claims that she was intentionally restrained between October 7 and October 13, 2016, because Johns Hopkins All Children's Hospital did not release her to her parents in this period before the court in the proceedings filed by the Department of Children and Families entered its shelter order. Second, Maya Kowalski claims she was intentionally restrained on or between October 18th and October 20th, 2016, when she was moved from her normal hospital room to another room containing video recording equipment, where she claims she was confined for approximately 48 hours. Third, Maya Kowalski claims she was intentionally restrained on January 6, 2017, when she was confined in a room where some of her clothing was removed against her will, and she was restrained while photographs were taken of her body. Johns Hopkins All Children's Hospital admits that it intentionally kept Maya Kowalski at the hospital between October 7 and October 13, 2016. It admits that it intentionally placed Maya Kowalski in another room on and between October 18th and October 20th, 2016, not 2026, 2016, to be video recorded. It also admits that it took photographs of Maya Kowalski. As to each instance of claimed false imprisonment, Johns Hopkins All Children's Hospital denies that its acts were unreasonable, unwarranted under all the circumstances, or without legal authority. The parties must prove all claims and defenses by the greater weight of the evidence. I will now define the terms you will use in deciding this claim. Greater weight of the evidence means the more persuasive and convincing force and effect of the entire evidence in the case. False imprisonment means that Johns Hopkins All Children's Hospital restrained Maya Kowalski with the purpose of causing the restraint or acted with knowledge that Maya Kowalski's restraint would, to a substantial certainty, result from the acts of Johns Hopkins All Children's Hospital. To be restrained means that Maya Kowalski was held against her will and did not consent to the restraint. In other words, a person is restrained when she is not free or does not reasonably believe she is free to leave the place to which she has been confined. To be restrained, a person must be aware of the restraint. An act of restraint is without lawful authority if Johns Hopkins All Children's Hospital did not act under color or a claim of lawful authority for that specific act. An unlawful and intentional restraint is a legal cause of loss, injury, or damage if it directly and in natural and continuous sequence produces or contributes substantially to producing such loss, injury, or damage, so that it can reasonably be said that, but for the unlawful and intentional restraint, the loss, injury, or damage would not have occurred. In order to be regarded as a legal cause of loss, injury, or damage, an unlawful and intentional restraint need not be the only cause. An unlawful and intentional restraint may be a legal cause of injury even though it operates in combination with the act of another, some natural cause or some other cause, if the unlawful and intentional restraint contributes substantially to producing such loss, injury, or damage. The issue for you to decide on Maya Kowalski's claim against Johns Hopkins All Children's Hospital are: A, whether Johns Hopkins All Children's Hospital, without legal authority, intentionally caused Maya Kowalski to be restrained against her will in a manner that was unreasonable and unwarranted under the circumstances, and if so, whether that restraint was a legal cause of loss, injury, or damage to Maya Kowalski. On the verdict form, you will be asked to make a decision concerning these issues for each of the 3 separate occasions claimed by Maya Kowalski. If the greater weight of the evidence does not support the claim of Maya Kowalski for any of the 3 occasions, your verdict should be for Johns Hopkins All Children's Hospital. However, if the greater weight of the evidence supports the claim by Maya Kowalski for one or more of these occasions, then your verdict should be for Maya Kowalski and against Johns Hopkins All Children's Hospital. If you find for Johns Hopkins All Children's Hospital, you will not consider the matter of damages. But if you find for Maya Kowalski, you should award Maya Kowalski an amount of money that the greater weight of the evidence shows will fairly and adequately compensate her for her loss, injury, or damage, as the greater weight of the evidence shows was caused by the occasions on which you find she was intentionally restrained. If you find for Maya Kowalski, you shall consider the following elements of damages for her. A, any bodily injury sustained by Maya Kowalski and any resulting pain and suffering mental anguish, inconvenience, or loss of capacity for the enjoyment of life experienced in the past. There is no exact standard for measuring such damage. The amount should be fair and just in the light of the evidence. And B, the reasonable value of medical and psychological treatment necessary or reasonably to be obtained by Maya Kowalski after she reaches the age of 18. If you find for Maya Kowalski but find that no loss, injury, or damage has been proven, then you should award Maya Kowalski nominal damages. Nominal damages are damages of an inconsequential amount which are awarded when a wrong has been done but no actual damage is proved. A parent is entitled to certain types of damage for a claim brought on behalf of a child. In this case, Jack Kowalski is the parent entitled to these damages. If you find for Maya Kowalski. If you find for her, you shall consider the following elements of damages for Jack Kowalski. A, the reasonable value or expense of hospitalization and medical, psychological, and nursing care and treatment necessarily or reasonably be obtained by Jack Kowalski for his child Maya Kowalski in the past or to be so obtained in the future until Maya Kowalski reaches the age of 18. If your verdict is for Johns Hopkins All Children's Hospital on each claimed occasion of false imprisonment, you will not decide the issue of punitive damages. If, however, you find for Maya Kowalski against Johns Hopkins All Children's Hospital on any of the claims of false imprisonment, then there is an additional claim in this case that you must decide. You must decide whether, in addition to compensatory damages, punitive damages are warranted as punishment to Johns Hopkins All Children's Hospital for the false imprisonment claims you have found for Maya Kowalski and as a deterrent to others. In this section, this additional claim for punitive damages involves only the claims for false imprisonment. The trial of punitive damages is divided into two parts. In this first part, you will decide whether the conduct of Johns Hopkins All Children's Hospital is such that punitive damages are warranted. If you decide that punitive damages are warranted, we will proceed to the second part of that issue after you have finished deliberating, during which the parties may present additional evidence and argument on the issue of punitive damages. I will then give you additional instructions, after which you will decide whether, in your discretion, punitive damages will be assessed, and if so, the amount. Punitive damages are warranted if you find by clear and convincing evidence that employees of Johns Hopkins All Children's Hospital involved in any false imprisonment were personally guilty of intentional misconduct or gross negligence which was a substantial cause of loss, injury, or damage to Maya Kowalski, and that A, the officers, directors, or managers of Johns Hopkins All Children's Hospital actively and knowingly participated in such conduct, or B, the officers, directors, or managers of Johns Hopkins All Children's Hospital knowingly condoned, ratified, or consented to such conduct of Catherine Beatty or other employees of Johns Hopkins All Children's Hospital, or C, Johns Hopkins All Children's Hospital engaged in conduct that constituted gross negligence and that contributed to the loss, damage, or injury to Maya Kowalski. Under those circumstances, you may, in your discretion, award punitive damages against Johns Hopkins All Children's Hospital. If clear and convincing evidence does not show such conduct by employees of Johns Hopkins All Children's Hospital involved in the false imprisonments, punitive damages are not warranted against Johns Hopkins All Children's Hospital as to false imprisonment. On the verdict form, you will be asked to make this decision for each of the 3 occasions claimed as false imprisonments. Intentional misconduct means that the employees of Johns Hopkins All Children's Hospital involved in the false imprisonments had actual knowledge of the wrongfulness of their conduct and the high probability that injury or damage to Maya Kowalski would result, and, despite that knowledge, intentionally pursued that course of conduct resulting in injury or damage to Maya Kowalski. Gross negligence means that the conduct of the employees of Johns Hopkins All Children's Hospital involved in the false imprisonments was so reckless or wanting in care that it constituted a conscious disregard or indifference to the life, safety, or rights of Maya Kowalski. Clear and convincing evidence differs from the greater weight of the evidence in that it is more compelling and persuasive. As I have already instructed you, greater weight of the evidence means the more persuasive and convincing force and effect of the entire evidence in the case. Clear and convincing evidence is evidence that is precise, explicit, lacking in confusion, and such weight that it produces a firm belief or conviction without hesitation about the matter in issue. A manager is more than a mid-level employee. It is someone who holds a position with the corporation which might result in the manager's acts being deemed the acts of the corporation. The second claim for your consideration is a claim of battery brought by Maya Kowalski against Johns Hopkins All Children's Hospital. Maya Kowalski claims that Catherine Beatty and a bedside nurse whose hands are shown in photographs in evidence, both of whom are employees of Johns Hopkins All Children's Hospital, committed battery by engaging in harmful or offensive personal contact upon Maya Kowalski with the intent to cause such contact. Maya Kowalski claims that Johns Hopkins All Children's Hospital is liable for battery for the acts of Catherine Beatty or bedside nurse during the time that Maya Kowalski was in the hospital. She claims that Miss Beatty committed battery by giving her unwanted touching, including hugging, patting, kissing, and placing her on her lap. She also claims that Miss Beatty or bedside nurse committed battery during the incident when Maya Kowalski claims she was intentionally restrained on January 6, 2017, and photographs were taken of her body. Johns Hopkins All Children's Hospital admits that it would be liable for any harmful or offensive contact with Maya Kowalski by Miss Beatty or the bedside nurse because their actions were done in the course and scope of employment with Johns Hopkins All Children's Hospital. Maya Kowalski must prove all claims by the greater weight of the evidence. I will now define some of the terms you will use in deciding this claim. Greater weight of the evidence means the more persuasive and convincing force and effect of the entire evidence in the case. Battery means a harmful or offensive physical contact upon another with the intent to cause such contact or the apprehension that such contact is imminent. It is not necessary that the contact cause physical injury. It is enough that the actor intends to make the contact and that the contact would be offensive to a reasonable person under like circumstances. A battery is a cause of loss, injury, or damage if it directly and in natural and continuous sequence produces or contributes substantially to producing such loss, injury, or damage, so that it can reasonably be said that, but for the harmful or offensive physical contact, the loss, injury, or damage would not have occurred. In order to be regarded as a legal cause of loss, injury, or damage, a battery need not be the only cause. A battery may be a legal cause of injury even though it operates in combination with the act of another, some natural cause, or some other cause if the battery contributes substantially to producing such loss, injury, or damage. The issue for you to decide on Maya Kowalski's claim against Johns Hopkins All Children's Hospital are whether Miss Beatty or bedside nurse committed a harmful or offensive contact upon the person of Maya Kowalski with the intent to make a contact that a reasonable person would find to be offensive under like circumstances. On the verdict form, you will be asked to decide this issue for each of the two batteries described. If the greater weight of the evidence does not support this claim of Maya Kowalski for either of the alleged batteries, your verdict should be for Johns Hopkins All Children's Hospital. However, if the greater weight of the evidence supports the claim by Maya Kowalski for one or both of the alleged batteries, then your verdict should be for Maya Kowalski and against Johns Hopkins All Children's Hospital. You will be asked on the verdict form to make a decision about the alleged battery on January 6th, 2017, separate from the other alleged battery. If you find for Johns Hopkins All Children's Hospital on both claim batteries, you will not consider the matter of damages. But if you find for Maya Kowalski against Johns Hopkins All Children's Hospital, you should award Maya Kowalski an amount of money that the greater weight of the evidence shows will fairly and adequately compensate her for the loss, injury, or damage, as the greater weight of the evidence shows was caused by the batteries committed by Catherine Beatty or bedside nurse. If you find for Maya Kowalski against Johns Hopkins All Children's Hospital, you shall consider the following elements of damages for her. A. Any bodily injury sustained by Maya Kowalski and any resulting pain and suffering, disability, or physical impairment, mental anguish, inconvenience, or loss of capacity for the enjoyment of life experienced in the past or to be experienced in the future. There is no exact standard for measuring such damage. The amount should be fair and just in the light of the evidence. And B, the reasonable value or expense of psychological treatment necessarily or reasonably to be obtained by Maya Kowalski after she reaches the age of 18. If you find for Maya Kowalski, but find that no loss, injury, or damage has been proven, you should award Maya Kowalski nominal damages. Nominal damages are damages of an inconsequential amount, which are awarded when a wrong has been done, but no actual damage is proved. Jack Kowalski is also entitled to certain types of damage as a parent for this claim brought on behalf of Maya Kowalski. If you find for Maya Kowalski against Johns Hopkins All Children's Hospital, you shall consider the following element of damages for Jack Kowalski as Maya Kowalski's parent. A. The reasonable value or expense of hospitalization and medical, psychological, and nursing care and treatment necessarily or reasonably obtained by Jack Kowalski for his child Maya Kowalski in the past or to be so obtained in the future until Maya Kowalski reaches the age of 18. Because the claim for the battery that allegedly occurred on January 6, 2017 occurred at the same time and place that Maya Kowalski claims she was intentionally restrained, your award of damages for this claim against Johns Hopkins Hospital should not duplicate an award that you make for the same loss, injury, or damage on the claim for the intentional restraint. If your verdict is for Johns Hopkins All Children's Hospital on the claim of battery on January 6, 2017, you will not decide the issue of punitive damages. If, however, you find for Maya Kowalski against Johns Hopkins All Children's Hospital on the claim of battery for the incident on January 6, 2017, then there is an additional claim in this case that you must decide. You must decide whether, in addition to compensatory, let me start that sentence again. I apologize. You must decide whether, in addition to compensatory damages, punitive damages are warranted as punishment to Johns Hopkins All Children's Hospital for the battery claim you have found for Maya Kowalski and as a deterrent to others. This additional claim for punitive damages involves only the claim of battery on January 6, 2017. It does not apply to any of the later claims in this lawsuit. The trial of punitive damages is divided into two parts. In this first part, you will decide whether the conduct of Johns Hopkins All Children's Hospital is such that the punitive damages are warranted. If you decide that punitive damages are warranted, we will proceed to the second part of that issue after you have finished deliberating, during which the parties may present additional evidence and argument on the issue of punitive damages. I will then give you additional instructions, after which you will decide whether, in your discretion, punitive damages will be assessed, and if so, the amount. Punitive damages are warranted if you find by clear and convincing evidence that Catherine Beatty or the bedside nurse involved in the claim of battery on January 6, 2017, were personally guilty of intentional misconduct or gross negligence, which was a substantial cause of loss, injury, or damage to Maya Kowalski, and that A, the officers, directors, or managers of Johns Hopkins All Children's Hospital actively and knowingly participated in such conduct, or B, the officers, directors, or managers of Johns Hopkins All Children's Hospital knowingly condoned, ratified, or consented to such conduct of Catherine Beatty or other employees of Johns Hopkins All Children's Hospital, or C, Johns Hopkins All Children's Hospital engaged in conduct that constituted gross negligence and that contributed to the loss, damages, or injury to Maya Kowalski. Under those circumstances, you may, in your discretion, award punitive damages against Johns Hopkins All Children's Hospital. If clear and convincing evidence does not show such conduct by Catherine Beatty or bedside nurse, punitive damages are not warranted against Johns Hopkins All Children's Hospital. On the verdict form, you will be asked to make this decision as to the battery claimed for the January 6, 2017 incident. Intentional misconduct means that Miss Beatty or bedside nurse had actual knowledge of the wrongfulness of their conduct and the high probability that injury or damage to Maya Kowalski would result, and, despite that knowledge, intentionally pursued that course of conduct, resulting in injury or damage to Maya Kowalski. Gross negligence means that Miss Beatty's or bedside nurse's conduct was so reckless or wanting in care that it constituted a conscious disregard or indifference to the life, safety, or rights of Maya Kowalski. Clear and convincing evidence differs from the greater weight of the evidence in that it is more compelling and persuasive. As I have already instructed you, greater weight of the evidence means the more persuasive and convincing force and effect of the entire evidence in the case. Clear and convincing evidence is evidence that is precise, explicit, lacking in confusion, and of such weight that it produces a firm belief or conviction without hesitation about the matter in issue. A manager is more than a mid-level employee. It is someone who holds a position with the corporation which might result in his or her acts being deemed the acts of the corporation. The third claim for your consideration in this case is as follows. Maya Kowalski claims that Johns Hopkins All Children's Hospital was negligent in the medical treatment of her while she was a patient at Johns Hopkins All Children's Hospital, and that its negligent treatment caused her harm. Johns Hopkins All Children's Hospital denies the claim. Maya Kowalski must prove all claims by the greater weight of the evidence. Greater weight of the evidence means the more persuasive and convincing force and effect of the entire evidence in the case. Preliminary issue concerning Dr. Sally Smith, a parent agent. Under Florida law, the Florida Department of Health is required to provide the services of a multidisciplinary child protection team in each of the zones of the Department of Children and Families. That team must be led by a medical director who is a doctor board certified in pediatrics and who has additional training in child abuse. The medical director of the child protection team for the zone serving Pinellas County in 2016 and 2017 was Dr. Sally Smith. In that capacity, Dr. Sally Smith was required to investigate reports of child abuse that were assigned to her child protection team. The hotline report concerning Maya Kowalski was assigned to her team. The employees of Johns Hopkins All Children's Hospital were obligated to cooperate with the investigation by the child protection team. As the medical director of the child protection team, Dr. Sally Smith was required to be capable of providing certain additional services. Those services included medical diagnosis and evaluation services and medical evaluation related to abuse, abandonment, or neglect as defined by policy or rule of the Department of Health. A child protection team may also provide consultation with respect to a child who is alleged to be abused when requested by any other professional involved with a child. Johns Hopkins All Children's Hospital's doctors and healthcare providers, however, were not required to follow incorrect diagnoses or evaluations, and they had an independent duty to Maya Kowalski to exercise independent medical judgment. When Dr. Sally Smith provided these services in her role as the medical director of the child protection team, she was not providing those services as an agent of any hospital. Dr. Sally Smith's role as medical director of the child protection team did not extend to treating Maya Kowalski. The parties agree that Johns Hopkins All Children's Hospital is legally responsible for the medical negligence of its doctors who are its employees or agents. In addition to the negligence of doctors who are its agents or employees, Johns Hopkins All Children's Hospital can become legally responsible for the medical negligence of a doctor who is not an employee or agent of the hospital when the doctor is what the law describes as an apparent agent of the hospital. Doctors are not employees or agents of a hospital merely because they have staff privileges at the hospital. They can, however, be treated as apparent agents of the hospital if the proof establishes that they fall within this category. In this case, the parties agree that Dr. Sally Smith was not an employee of Johns Hopkins All Children's Hospital. There is, however, an issue for your resolution whether Dr. Sally Smith was an apparent agent of Johns Hopkins All Children's Hospital. Maya Kowalski claims that Dr. Sally Smith was an apparent agent of Johns Hopkins All Children's Hospital and that Dr. Sally Smith also was negligent in her medical treatment of Maya Kowalski while acting within the scope of her apparent authority. Johns Hopkins All Children's Hospital denies that Dr. Sally Smith was its apparent agent. Dr. Sally Smith was an apparent agent if Johns Hopkins All Children's Hospital, by its words or conduct, caused or allowed Beata or Jack Kowalski or both to believe that Dr. Sally Smith was an agent of and had authority to act for Johns Hopkins All Children's Hospital, and if Beata Kowalski or Jack Kowalski relied upon that belief in dealing with Dr. Sally Smith as the agent of Johns Hopkins All Children's Hospital. A person is responsible for the negligence of its apparent agent at the time and place of the alleged negligence of the apparent agent if the apparent agent was acting within the scope of her apparent authority. If the greater weight of the evidence does not support Maya Kowalski's claim that Dr. Sally Smith was an apparent agent of Johns Hopkins All Children's Hospital at the time and place of any medical negligence that Maya Kowalski claims that Dr. Smith committed, that's Dr. Sally Smith, then your verdict on the claim of Maya Kowalski concerning the alleged medical negligence of Johns Hopkins All Children's Hospital in this case cannot be based on claimed medical negligence by Dr. Sally Smith. If, however, the greater weight of the evidence supports Maya Kowalski's claim that Dr. Sally Smith was an apparent agent of Johns Hopkins All Children's Hospital at the time of any act of medical negligence, and that Dr. Sally Smith was acting within the scope of her apparent authority, then your verdict on the medical negligence claim against Johns Hopkins All Children's Hospital can be based on the medical negligence by Dr. Sally Smith. Remainder of medical negligence instructions. Now that I have explained this preliminary issue, I will now define additional terms you will use in deciding this claim of medical negligence. Negligence is the failure to use reasonable care. Reasonable care on the part of a doctor or hospital is that level of care, skill, and treatment which, in the light of all relevant surrounding circumstances, is recognized as acceptable and appropriate by similar and reasonably careful doctors or hospitals. Negligence on the part of a doctor or hospital is doing something that a reasonably careful doctor or hospital would not do under like circumstances, or failing to do something that a reasonably careful doctor or hospital would do under like circumstances. Negligence is a legal cause of loss, injury, or damage if it directly and in natural and continuous sequence produces or contributes substantially to producing such loss, injury, or damage, so that it can be reasonably said that, but for the negligence, the loss, injury, or damage would not have occurred. In order to be regarded as a legal cause of loss, injury, or damage, negligence need not be the only cause. Negligence may be a legal cause of loss, injury, or damage, even though it operates in combination with the act of another or some other cause, if the negligence contributes substantially to producing such loss, injury, or damage. The issues that you must decide on Maya Kowalski's claim against Johns Hopkins All Children's Hospital are whether the Johns Hopkins All Children's Hospital was negligent through any of its employee doctors or through any apparent agent doctor in the medical care and treatment of Maya Kowalski, and, if so, whether that negligence was a legal cause of loss, injury, or damage to Maya Kowalski. If the greater weight of the evidence does not support Maya Kowalski's claim, then your verdict should be for Johns Hopkins All Children's Hospital on this claim. However, if the greater weight of the evidence supports the claim of Maya Kowalski, then your verdict should be for Maya Kowalski and against Johns Hopkins All Children's Hospital on this claim. If you find for Johns Hopkins All Children's Hospital, you will not consider the matter of damages. But if you find for Maya Kowalski, you should award her an amount of money that the greater weight of the evidence shows will fairly and adequately compensate her for the loss, injury, or damage, as the greater weight of the evidence shows was caused by the conduct complained of. If you find for Maya Kowalski, you shall consider the following elements of damages. A. Any bodily injury sustained by Maya Kowalski and any resulting pain and suffering, disability or physical impairment, mental anguish, inconvenience, or loss of capacity for the enjoyment of life, experienced in the past or to be experienced in the future. There is no exact standard for measuring such damage. The amount should be fair and just in the light of the evidence. B. The reasonable value or expense of hospitalization and medical, psychological, and nursing care and treatment necessarily or reasonably to be obtained by Maya Kowalski. And C. Any loss of ability to earn money in the future by Maya Kowalski. If you find that Johns Hopkins All Children's Hospital caused a bodily injury and that the injury resulted in an aggravation of an existing disease or physical defect, you should attempt to decide what portion of Maya Kowalski's condition resulted from the aggravation. If you can make that determination, then you should award only those damages resulting from the aggravation. However, if you cannot make that determination, or if it cannot be said that the condition would have existed apart from the injury, then you should award damages for the entire condition suffered by Maya Kowalski. The fourth claim for your consideration in this case is brought by Jack Kowalski against Johns Hopkins All Children's Hospital. He claims that Johns Hopkins All Children's Hospital fraudulently billed the Kowalskis and their health insurers, falsely claiming that the hospital was treating Maya Kowalski for CRPS. He claims this fraudulent information caused him harm. Johns Hopkins All Children's Hospital denies this claim. Mr. Kowalski let me start again. Mr. Kowalski must prove all claims and defenses by the greater weight of the evidence. I will now define the terms you will use in deciding this case. And members of the jury, where it says must prove all claims and defenses, it just should say must prove all claims by the greater weight of the evidence. So please strike out and defenses. Mr. Kowalski must prove all claims by the greater weight of the evidence. I will now define terms you will use in deciding this case. It's a lot of talking for me. Greater weight of the evidence means the more persuasive and convincing force and effect of the entire evidence in the case. A material fact is one that is of such importance that Mr. Kowalski or his insurance company would have acted or would have refrained from acting but for the false statement about it. Misrepresentation of a material fact is a legal cause of loss, injury, or damage if it directly and in natural and continuous sequence produces or contributes substantially to producing such loss or damage, so that it can reasonably be said that, but for the misrepresentation, the loss, injury, or damage would not have occurred. In order to be regarded as a legal cause of loss, injury, or damage, a misrepresentation of a material fact need not be the only cause. Misrepresentation of a material fact may be a legal cause of loss, injury, or damage even though it operates in combination with some other cause if the misrepresentation contributes substantially to producing such loss, injury, or damage. The issues for you to decide on the claim for fraudulent billing are: A, whether Johns Hopkins All Children's Hospital made a false statement concerning a material fact in or in regard to its billing. B, whether Johns Hopkins All Children's Hospital knew the statement was false when it made it, or made the statement knowing it did not know whether it was true or false. C, whether Johns Hopkins All Children's Hospital intended that another would rely on the false statement. D, whether Mr. Kowalski or his insurance company relied on the false statement. And E, whether the reliance on the false statement was a legal cause of loss, injury, or damage to Mr. Kowalski. If the greater weight of the evidence does not support the claim of Mr. Kowalski, your verdict should be for Johns Hopkins All Children's Hospital on this claim. However, if the greater weight of the evidence supports the claim, then your verdict should be for Mr. Kowalski and against Johns Hopkins All Children's Hospital on this claim. If you find for Johns Hopkins All Children's Hospital, you will not consider the matter of damages. But if you find for Mr. Kowalski, you should award them an amount of money that the greater weight of the evidence shows will fairly and adequately compensate them for any monetary loss or damage sustained by them and caused by the fraud. You shall consider the following elements of damage. A, any deductibles or co-pays incurred by the plaintiffs as a result of Maya Kowalski's sheltering at Johns Hopkins All Children's Hospital, or increases in their cost of insurance coverage in the past or in the future, including increased premiums, co-pays, and higher deductibles, and reimbursement for the difficulty of finding insurance in the future. The fifth claim for your consideration in this case is brought by the estate of Beata Kowalski against Johns Hopkins All Children's Hospital. The estate claims that during the time that Maya Kowalski was a patient at the hospital, Johns Hopkins All Children's Hospital acted extremely and Let me read the sentence again. The estate claims that during the time that Maya Kowalski was a patient at the hospital, Johns Hopkins All Children's Hospital acted extremely and outrageously, causing Beata Kowalski severe emotional distress. In this claim, the estate claims that the extreme and outrageous conduct of Johns Hopkins All Children's Hospital caused Beata Kowalski to suffer severe emotional distress prior to her death. Through this claim, the estate now seeks to recover for that harm. Johns Hopkins All Children's Hospital denies this claim. The estate must prove its claim by the greater weight of the evidence. I will now define some of the terms you will use in deciding this claim. Greater weight of the evidence means the more persuasive and convincing force and effect of the entire evidence in the case. Extreme and outrageous conduct is behavior which, under the circumstances, goes beyond all possible bounds of decency and is regarded as shocking, atrocious, and utterly intolerable in a civilized community. Emotional distress is severe when it is of such intensity or duration that no ordinary person should be expected to endure it. Extreme and outrageous conduct is a legal cause of severe emotional distress if it directly and in natural and continuous sequence produces or contributes substantially to producing such severe emotional distress, so that it can reasonably be said that, but for the extreme and outrageous conduct, the severe emotional distress would not have occurred. In order to be regarded as a legal cause of severe emotional distress, extreme and outrageous conduct need not be the only cause. Extreme and outrageous conduct must be a legal cause of severe emotional distress, even though the act of another or some other cause also contributes to the distress. The issue for you to decide on the estates, and that should read fifth claim. The issues for you to decide on the estate's fifth claim are: 1. Whether Johns Hopkins All Children's Hospital, through its agents and employees, engaged in extreme and outrageous conduct during the time that Maya Kowalski was a patient at the hospital and acted with the intent either to cause Beata Kowalski severe emotional distress or with reckless disregard of the high probability of causing Beata Kowalski severe emotional distress. And if so, 2, whether that extreme and outrageous conduct was a legal cause of severe emotional distress to Beata Kowalski. If the greater weight of the evidence does not support the estate's claim, your verdict should be for Johns Hopkins All Children's Hospital. However, if the greater weight of the evidence supports the estate's claim, your verdict should be for the estate and against Johns Hopkins All Children's Hospital. If your verdict is for Johns Hopkins All Children's Hospital, you will not consider the matter of damages. But if the greater weight of the evidence supports the estate's claim, you should determine and write on the verdict form in dollars the total amount of loss, injury, or damage which the greater weight of the evidence shows will fairly and adequately compensate the estate for the loss, injury, or damage occurring prior to the death of Beata Kowalski on January 8, 2017. If you find for the estate, you shall consider the following elements. A. Any resulting pain and suffering, mental anguish, experienced by Beata, let me read again. If you find for the estate, you shall consider the following elements. Any resulting pain and suffering or mental anguish experienced by Beata Kowalski prior to her death on January 7th, 2017. There is no exact standard for measuring such damage. The amount should be fair and just in the light of the evidence. Now, members of the jury, I noticed that we, in one case, said that Beata Kowalski died on January 7th and another time on January 8th. I think the evidence was it was in that time frame. I apologize, I was not consistent, but the intent here is the damages before her death, okay? Whether it's on January 7th, the evening of the January 7th, or the morning of the 8th. Moving on to Claim 6. The sixth claim for your consideration in this case is a claim brought by the estate of Beata Kowalski. The estate claims that Johns Hopkins All Children's Hospital acted extremely and outrageously during the time that Maya Kowalski was a patient at the hospital, and that this conduct is a legal cause of Beata Kowalski's death by suicide. Johns Hopkins All Children's Hospital denies this claim. If you decide on the verdict form for the survivor claim, the fifth claim, that the estate did not prove its claim. Actually, can I see the attorneys for a second on this? Juror who passed me the note, are we able to finish the reading of the instructions? Probably another 30 minutes. Okay. I'm going to restart at the beginning of page 46 because exactly know where I was. The sixth claim for your consideration in this case is a claim brought by the estate of Beata Kowalski. The estate claims that Johns Hopkins All Children's Hospital acted extremely and outrageously during the time that Maya Kowalski was a patient at the hospital, and that this conduct is a legal cause of Beata Kowalski's death by suicide. Johns Hopkins All Children's Hospital denies this claim. If you decide on the verdict form for the survivor claim, which is the fifth claim, that the estate did not prove its claim that Johns Hopkins All Children's Hospital acted extremely and outrageously, causing Beata Kowalski severe emotional distress, then you must also decide in favor of Johns Hopkins All Children's Hospital on this sixth claim. However, if you decide on the verdict form for the survivor claim, which is the fifth claim, and that the estate did prove its claim that Johns Hopkins All Children's Hospital acted extremely and outrageously, causing Beata Kowalski severe emotional distress, then you must also decide the issues in this sixth claim. The estate must prove its claims by the greater weight of the evidence. I will now define some of the terms you will use in deciding this claim. Greater weight of the evidence means the more persuasive and convincing force and effect of the entire evidence in the case. Extreme and outrageous conduct is behavior which, under the circumstances, goes beyond all possible bounds of decency and is regarded as shocking, atrocious, and utterly intolerable in a civilized community. Emotional distress is severe when it is of such intensity or duration that no ordinary person should be expected to endure it. I apologize. Was I at the greater weight instruction?
You're at the issue for you to decide.
Okay, I apologize, members of the jury. The issue for you to decide on the estate's wrongful death claim are: 1, whether Johns Hopkins All Children's Hospital, through its employees or agents, engaged in extreme and outrageous conduct during the time that Maya Kowalski was a patient at the hospital, and acted with the intent either to cause Beata Kowalski severe emotional distress or with reckless disregard of the high probability of causing Beata Kowalski severe emotional distress, and, if so, whether that extreme and outrageous conduct was a legal cause of Beata Kowalski's death by suicide. Johns Hopkins All Children's Hospital did not need to specifically intend for the conduct of its agents and employees to cause Beata Kowalski to die by suicide. However, the agents and employees of Johns Hopkins All Children's Hospital needed to engage in extreme and outrageous conduct with the intent to cause Beata Kowalski severe emotional distress, or with reckless disregard of the high probability of causing Beata Kowalski severe emotional distress, sufficient to be a legal cause of her death by suicide. To be a legal cause of Beata Kowalski's death by suicide, the extreme and outrageous conduct must either: 1, create in Beata Kowalski an uncontrollable impulse to commit suicide, or 2, be a substantial factor in bringing about the suicide. Uncontrollable impulse means a mental state that prevented Beata Kowalski from appreciating the nature of the act of suicide or controlling her conduct. In order to be regarded as a legal cause of death by suicide, Extreme and outrageous conduct need not be the only cause. Extreme and outrageous conduct may be a legal cause of severe emotional distress, even though it operates in combination with the act of another or some other cause, if the extreme and outrageous conduct contributes substantially to producing such severe emotional distress. If the greater weight of the evidence does not support the estate's claim, your verdict should be for Johns Hopkins All Children's Hospital. However, if the greater weight of the evidence supports the estate's claim, then your verdict should be for the estate and against Johns Hopkins All Children's Hospital. If your verdict is for Johns Hopkins All Children's Hospital, you will not consider the matter of damages. But if the greater weight of the evidence supports the estate's claim, you should determine and write on the verdict form in dollars the total amount of loss, injury, or damage which the greater weight of the evidence shows the estate of Beata Kowalski and her survivors sustained as a result of her injury and death, including any damages that the estate and the survivors are reasonably certain to occur or experience in the future. Elements of damage for the estate. In determining the damages recoverable on behalf of the estate of Beata Kowalski, you shall consider the following elements: the estate's loss of net accumulations. Net accumulations is the part of Beata Kowalski's net income from salary after taxes, including pension benefits, which Beata Kowalski, after paying her personal expenses and monies for the support of her survivors, would have left as part of her estate if she had lived her normal life expectancy. Elements of damage for surviving spouse and children. In determining any damages to be awarded the estate for the benefit of Beata Kowalski's surviving spouse and children, you shall consider certain additional elements of damage for which there is no exact standard for fixing the compensation to be awarded. Any such award should be fair and just in the light of the evidence regarding the following elements. A. Damages of surviving spouse. Jack Kowalski's loss of Beata Kowalski's companionship and protection and his mental pain and suffering as a result of Beata Kowalski's death. In determining the duration of the losses, you may consider the life expectancy of Jack Kowalski together with the other evidence in the case. B. Damages by surviving children. The loss by Kyle Kowalski and Maya Kowalski of parental companionship, instruction, and guidance, and their mental pain and suffering as a result of Beata Kowalski's death. In determining the duration of those losses, you may consider the life expectancy of each of the surviving children together with other evidence in the case. C. Loss, support, and services. The survivors, Jack Kowalski, Maya Kowalski, and Kyle Kowalski's loss by reason of Beata Kowalski's injury and death of Beata Kowalski's support and services from the date of injury to the date of death. In determining the duration of any future loss, you may consider the joint life expectancy of the survivors and Beata Kowalski in the period of minority, ending at age 25, of Maya Kowalski and Kyle Kowalski. And D. Medical and funeral expenses. The medical and funeral expenses resulting from Beata Kowalski's death paid by Jack Kowalski. In evaluating past and future loss of support and services, you shall consider the survivor's relationship to Beata Kowalski, the amount of Beata Kowalski's probable net income available for distribution to the survivor, and the replacement value of Beata Kowalski's services to the survivors. Support includes contributions in kind as well as sums of money. Services means tasks regularly performed by Beata Kowalski for a survivor that will be a necessary expense to the survivor because of Beata Kowalski's death. Any damages that you find were sustained by Beata Kowalski's estate and by Jack Kowalski, Maya Kowalski, and Kyle Kowalski shall be separately stated in your verdict. Mortality tables. In determining how long Beata Kowalski would have lived had she lived out her normal life, you may consider her life expectancy at the time of her death. The mortality tables received in evidence may be considered in determining how long she may have been expected to live. Mortality tables are not binding on you, but may be considered together with other evidence in the case bearing on her health, age, and physical condition before her death in determining the probable length of her life. In determining the duration of any future loss sustained by Jack Kowalski, Maya Kowalski, and Kyle Kowalski by reason of the death of Beata Kowalski, you may consider the joint life expectancy of Jack Kowalski, Maya Kowalski, and Kyle Kowalski, and Beata Kowalski. The joint life expectancy is that period of time when both the decedent and a survivor would have remained alive. The mortality tables received in evidence may be considered together with the other evidence in the case in determining how long each may have been expected to live. Any amount of damages which you allow for the estate's loss of net accumulations should be reduced to its present money value, and only the present money value of these future economic damages should be included in your verdict. The present money value of future economic damages is the sum of money needed now, which, together with what that sum will earn in the future, will compensate for these losses as they are actually experienced in future years. The seventh claim for your consideration in this case is brought by Maya Kowalski against Johns Hopkins All Children's Hospital. Maya Kowalski claims that Johns Hopkins All Children's Hospital acted extremely and outrageously during the time that she was a patient at Johns Hopkins All Children's Hospital. Johns Hopkins All Children's Hospital denies this claim. Maya Kowalski must prove her claim by the greater weight of the evidence. I will now define some of the terms you will use in deciding this claim. Greater weight of the evidence means the more persuasive and convincing force and effect of the entire evidence in the case. Extreme and outrageous conduct is behavior which, under the circumstances, goes beyond all possible bounds of decency and is regarded as shocking, atrocious, and utterly intolerable in a civilized community. Emotional distress is severe when it is of such intensity or duration that no ordinary person should be expected to endure it. Extreme and outrageous conduct is a legal cause of severe emotional distress if it directly and in natural and continuous sequence produces or contributes substantially to producing such severe emotional distress, so that it can reasonably be said that, but for the extreme and outrageous conduct, the severe emotional distress would not have occurred. In order to be regarded as a legal cause of severe emotional distress, extreme and outrageous conduct need not be the only cause. Extreme and outrageous conduct may be a legal cause of severe emotional distress, even though the act of another or some other cause also contributes to the distress. The issues for you to decide on Maya Kowalski's claims are: A, whether Johns Hopkins All Children's Hospital engaged in extreme and outrageous conduct and acted with the intent either to cause severe emotional distress or with reckless disregard of the high probability of causing severe emotional distress to Maya Kowalski, and, if so, whether the extreme and outrageous conduct was a legal cause of severe emotional distress to Maya Kowalski. If the greater weight of the evidence does not support Maya Kowalski's claim, your verdict should be for Johns Hopkins All Children's Hospital. However, if the greater weight of the evidence supports Maya Kowalski's claim, then your verdict should be for Maya Kowalski and against Johns Hopkins All Children's Hospital. If your verdict is for Johns Hopkins All Children's Hospital, you will not consider the matter of damages. But if the greater weight of the evidence supports Maya Kowalski's claim, you should determine and write on the verdict form in dollars the total amount of loss, injury, or damage which the greater weight of the evidence shows will fairly and adequately compensate Maya Kowalski for the loss, injury, or damage caused by the extreme and outrageous conduct. If you find for Maya Kowalski, you shall consider the following elements. A. Any emotional distress sustained by Maya Kowalski and any resulting bodily injury, disability, or physical impairment, mental anguish, inconvenience, or loss of capacity for the enjoyment of life experienced in the past or to be experienced in the future. There is no exact standard for measuring such damage. The amount should be fair and just in the light of the evidence. B. The reasonable value of medical care and treatment necessarily or reasonably obtained by Maya Kowalski in the past or to be obtained in the future. C. Any loss of ability to earn money sustained in the future. Aggravation or activation of disease or defect. If you find that Johns Hopkins All Children's Hospital caused a bodily injury and that the injury resulted in an aggravation of an existing disease or physical defect, you should attempt to decide what portion of Maya Kowalski's conditions resulted from the aggravation. If you can make that determination, you should award only those damages resulting from the aggravation. However, if you cannot make that determination, or if it cannot be said that the condition would have existed apart from the injury, then you should award damages for the entire condition suffered by Maya Kowalski. In deciding this case, it is your duty as jurors to decide the issues, and only those issues that I submit for your determination. You must come to an agreement about what your answers will be. Your agreed upon answers to my questions are called your jury verdict. The evidence in this case consists of the sworn testimony of the witnesses, all exhibits received in evidence, and all the facts that were admitted or agreed to by the parties. In reaching your verdict, you must think about and weigh the testimony in any documents, photographs, or other material that has been received in evidence. You may also consider any facts that were admitted or agreed to by the lawyers. Your job is to determine what the facts are. You may use reason and common sense to reach conclusions. You may draw reasonable inferences from the evidence, but you should not guess about things that were not covered here, and you must always apply the law as I have explained it to you. Let me speak briefly about witnesses. In evaluating the believability of any witnesses and the weight you will give the testimony of any witnesses, you may properly consider the demeanor of the witnesses while testifying, the frankness or lack of frankness of the witness, the intelligence of the witness, any interest the witness may have in the outcome of the case, the means and opportunity the witness had to know the facts about which the witness testified, the ability of the witness to remember the matters about which the witness testified, the ability of the witness to remember the matters about which the witness testified, and the reasonableness of the testimony of the witness, considered in the light of all the evidence in the case and in the light of your own experience and common sense. You have heard opinion testimony on certain technical subjects from persons referred to as expert witnesses. You may accept such opinion testimony, reject it, or give it the weight you think it deserves, considering the knowledge, skill, experience, training, or education of the witness, the reasons given by the witness for the opinion expressed, and the other evidence in the case. It is entirely proper for a lawyer to talk to a witness about the testimony the witness would give if called to the courtroom. The witness should not be discredited just because the witness talked with a lawyer about his or her testimony. In your deliberations, you will consider and decide several distinct claims. Although these claims have been tried together, each is separate from the others, and each party is entitled to have you separately consider each claim as it affects that party. Therefore, in your deliberations, you should consider the evidence as it relates to each claim separately, as you would had each claim been tried separately. Although these claims are separate claims, it is possible that separate claims may result in overlapping damages. Your verdict should not award damages twice for the same loss, injury, or damage, even if they result from different claims. Your award of monetary damages for each claim, if any, must not duplicate the same damage awarded in the other claims. That is the law you must follow in deciding this case. Tomorrow morning, the attorneys for the parties will present their final arguments to you. And when they are through tomorrow, I will have a few final instructions about your deliberations. Now, we're going to pause it right there. And that's going to be all of the instructions I am going to read. Can I see the attorneys for a moment up here, please? Okay, members of the jury, in a moment I'm going to let you retire to the deliberations room, but you are not to begin to deliberate anything because we're going to have additional arguments tomorrow and some further jury instructions. You're not going to go home just yet, but I am going to be sending you back into the jury deliberation room. So do not discuss this case amongst yourselves. Do not do any investigation and receive no information. Now, I'm going to send 11 of you. I'm going to keep juror number 181 out here with us. Okay, so if the 11 of you can go back into the jury deliberation room.
All rise. Jurors exit.
Okay, everyone, please be seated. The only juror that remains with us is juror number 181. All 11 other jurors are not with us. I did receive your note, and I have discussed it with the attorneys, and I'm sorry that you're experiencing the issue that you put in your note. I don't want to say what it is. What I'm going to do is I'm going to discharge you from your further service of jury duty. I already have a juror note for you. There's a whole bunch of things I would like to say that I don't have time to go into, so I'm just going to kind of give you the short statements here. Number one, I have already entered a court order prohibiting the disclosure of the names of the jurors until after the trial is over. You know the names of the jurors. So I'm telling you, until the trial is over and everything's done, you cannot let anyone know the name, identity, where they work. Do you understand that? Okay. You're going to be free of all other instructions. And so in a moment, I'll tell you what that means. But the bottom line is you're going to be free to talk about whatever you want. You're going to be free to look at whatever you want. You're going to be free not to talk about whatever you want. That's going to be totally up to you. But one of the most important things I need you to remember is until this is all over, you cannot say anything about the names of the other jurors. Unfortunately, because I'm going to be discharging you, I cannot have you say goodbye to the others. And I feel very sorry that I'm going to have to do that to you. What I will do is if you leave your telephone number with the court deputy, and if you are comfortable with it, when this is all over, I will give your telephone number to the other jurors. And then they can contact you, and then I'll ask them to give me their numbers so that you all can communicate back and forth. But that's not going to happen until after this is all over. So it's totally up to you if you want to leave your telephone number for us to give to the other jurors. And again, I apologize that you're not going to get to talk or say goodbye to everybody else. You have given us over 9 weeks of your time and attention. You took copious notes. You asked lots of questions. You did everything we asked you to do as a citizen of the state of Florida. And I cannot tell you how much I appreciate it. I know you have a job, and I know your employer has given up your skills while you were with us. And so on behalf of all the lawyers in this case, and on behalf of the court, I want to say thank you. I do have a certificate. I didn't know this was going to happen, so I don't have the certificate ready, but I will send that to you as well. Also, if you leave us your cell phone number, when we have a verdict, my assistant will call you. If you want to come on down to watch, you can do that. If you want to sign online to the Zoom or tap into any of the number of feeds that are being broadcast, you will be able to do that. So with that, I'm going to go ahead and give you the formal discharge instruction. And I'm going to file this note, although Madam Clerk, he put his name on it, so the name has to remain protected. On behalf, and Juror 181, on behalf of the parties, lawyers, and the people of the state of Florida, I wish to thank you for your time and consideration of this case. And I also wish to advise you of some very special privileges enjoyed by jurors. No juror, that would include you, can be required to talk about the discussions that occurred in the jury room except by court order. For many centuries, our society has relied upon juries for consideration of difficult cases. We have recognized for hundreds of years that the jury's deliberations, discussions, and votes should remain their private affair so long as you wish. And I know you didn't deliberate, and I know you haven't been discussing the case, but I'm just reading you the instruction. Therefore, the law gives you a unique privilege not to speak about the jury's work. The lawyers and their representatives are not permitted to approach you. They are not permitted to initiate any communication with you about the trial. However, you are free, if you wish to speak with any of the lawyers or anyone else about this trial, you may do that. Can't tell anybody the names of the other jurors until this is all over. So you have the right to refuse to speak with anyone, and you can also talk. It's going to be totally up to you. Please understand that a request may come from those who are simply curious or those who may seek to find fault with you. And it's going to be up to you to determine whether to preserve your privacy as a juror. So, do you have anything in the back room? So you do not need to go back in there? Okay, so what I'm going to ask the sheriff's office to do is to take him out that door and take him directly to his vehicle, and let me know when he is gone so we can then let the other jurors go, because I don't want there to be any possibility of them overlapping. So what I'm going to do is, and I'm going to ask the TV folks, as he goes through this other door, let's make sure we do not capture his face. Thank you very much for yours. I hope the medical issue resolves in a quick fashion for you. Okay, thank you.
All rise.
Okay, everyone can please be seated. Sorry, I didn't mean to do that. I just have to wait for another deputy to come so I can bring back the other 11. Why don't you bring them in?
Jurors entering.
Okay, everyone, please be seated. Members of the jury, I want to confirm while you're away, you did not discuss this case amongst yourselves, you did not do any investigation, and you did not receive any information about this case. Is that correct?
Correct.
And no one's approached you about this case. Is that correct?
Correct.
And has anyone seen any media coverage about this case?
No.
Okay. You will see that one of your number is no longer with us. He was suffering a medical issue. We will proceed with 11. Okay. I need him to get to his car because I can't have him have any contact with you. I've told him a couple of things. Number one, that he is not allowed to disclose your identity or where you work until after this is all over. Okay, so don't worry about that. He understands that issue. I also said that if he wants to leave his telephone number, I would be happy to share it with you after this is all over. And if you wish to leave your telephone number so I can share with him, I'm happy to do that. It's just I told him he is not, and even if he has one or more of your cell phone numbers, he is not allowed to contact you until this is all over, and he understands that. But if for whatever reason he does attempt to contact you, you cannot have any contact. I apologize that you haven't had a chance to say goodbye, but that's just the way I need to run it this way. Okay? So as soon as I discharged him, he can't cross your path. So that is the reason why I've done it the way I've done it. Now, I will also say a couple more things. Tomorrow you're going to be deliberating, and I have told you we're going to take your cell phone and any sort of like smart watch or anything like that away from you. A lot of times what juries find is when we get to this stage, things happen rather quickly, and then all of a sudden it's over and everybody's gone. If you all wish to share amongst yourselves your cell phone numbers and whatnot, it's up to you. I don't care. It's up to you if you want to do that. It's a good idea to do it today as opposed to tomorrow. Okay? Just if you're going to do that, get it out of the way. And so when you come tomorrow, we're focused on the closing arguments and then the beginning of deliberations. Now, let's talk about the time for tomorrow. I asked you before we went to lunch if we can start earlier. I saw there might have been some, so I don't know. Do you want to start earlier, 30 minutes early, 15 minutes earlier, or the regular time? Early, so be here to start at 8:30. Is that comfortable for everybody? I mean, is it going to cause a problem for anybody? Okay. Now, a couple other things. I'm going to, when you come in tomorrow, we're going to ask for your lunch order from wherever we're going to get the lunch. I don't know where that is. So we'll get that done right out of the way. Just make sure on your lunch order you put your juror number, not your name, but your juror number on the order, because I don't want your names going to wherever we're going to go to lunch. So we all remember our juror numbers? Okay. Timing for tomorrow evening. I'm going to kind of let that be the jury's determination within reason. I mean, I'm not going to stay until 1 o'clock at night. If you come and decide at some point you still want more time to deliberate, that's fine. If you want to leave at whatever time, so long as you put in a full day tomorrow, that's fine. If you want to go into the evening somewhat, that's fine. That's going to be up to the jury. I know is it Wednesday, we've got to stop early. So, we'll stop at whatever time we need to stop on Wednesday. So, have we heard if we're clear at this point? Okay. So, Juror 181 is now gone. Again, I apologize for the way all that went down, but it's the way I need to do it to make sure, one, that we don't have any sort of issue now that we're 9 weeks into this trial. I would hate to have an issue arise that caused us to start this whole thing over. So I'm just being overly protective of doing this properly. Do not discuss this case amongst yourselves. Do not do any of it. Is there anything else I need to instruct the jury before I let them go for the day? Okay, we will see you at 8:30 tomorrow. Do not discuss this case. Do not do any investigation. Receive no information.
All rise. Jurors exit.